Good morning, everyone. Welcome to the October 31st Governance and Priorities Committee meeting. I'd like to first recognize that we are on the traditional territory of the Snuneymuxw First Nation. Our clerk today is Sheila Gurry. We also have the following councillors attending electronically. So we have Councillor Perino, who is in her car waiting for an exciting announcement at the NRGH at the hospital. Today's Governance and Priority Committee meeting will be held in accordance with the Community Charter and the Council Procedure Bylaw 2018, number 7272. If during the meeting any member of the gallery has a question on a matter that was considered by the committee today, please sign up on the sheet located at the table by the double doors to my left. Please note that the Council Procedure Bylaw states questions will only be taken on staff reports or other business items. Before we start the meeting, I'd like to take a few moments to remind those who are in attendance in person about rules of decorum for all council and committee meetings. A meeting of council is intended to be a place where democracy can freely take place in a respectful and safe manner. The council chambers is a workplace, and there are considerations council and staff must make to ensure that a safe work environment exists in accordance with WorkSafe BC regulations. To support this and in accordance with Council's procedure bylaw, disrespectful conduct will not be tolerated, so we ask that there is no cheering, jeering, or other disruptions from the gallery. Furthermore, the use of electronic devices for recording or photography is prohibited unless otherwise authorized through the media accreditation policy or by the chair. This will ensure that anyone speaking, whether it be a delegate, member of council, staff, is not interrupted and can make their point freely without distraction, fear of ridicule, or intimidation. That said, there may be moments during certain presentations or recognitions where clapping or expressions of appreciation are welcomed. I'll indicate when those moments are appropriate. In instances where a speaker is being inappropriate or has exceeded their time limit, the microphone will be cut off. Similarly, if there are disruptions by any person in the gallery, they will be asked to stop, and if they do not comply, they may be asked to leave as permitted under Section 133 of the Community Charter. If necessary, Council may call a recess in order to reset the environment of the Council chambers. It is our belief that if everyone is respectful of these basic considerations, this meeting and future meetings will be more effective in furthering the business of the City of Nanaimo. The first item on the agenda is the introduction of lead items. Ms. Curry.
Thank you, Chair. So we don't have any late items this morning. There is an addition of the staff presentations that were missing from the original agenda. For the last item on the agenda, item C, under C, Manufactured Home Community Relocation Assistance Policy, we had missed the additions of the staff, so the staff presentations have been added, and that's it, Chair.
Thank you. I'd like to, is there a motion for adoption of the agenda? Moved Councillor Brown, seconded Mayor Krogh. All those in favor? Seeing none opposed, carries. Motion of adoption of minutes as circulated. Moved by Councillor Easner, seconded by Councillor Hemmons. All those in favor? Seeing none opposed, motion passes. Next on the agenda is agenda planning, upcoming topics and initiatives to be introduced by Sheila Gurry, Director of Legislative Services.
Thank you, Chair. So on your agenda is the list of upcoming topics and initiatives, and there it is on the screen. So it shows our next meeting at the end of November, November 24th, and what is scheduled there. Our December 8th meeting, and to be determined our meeting in January. Your schedule for next year's council and committee meetings will be coming later on in November. So a to be determined date in January has those tentatively scheduled topics. Under other tentative GPC topics noted there is topics that either staff have initiated, those are the clear background, and those that are an integrated action plan item. So those are tentative GPC topics that we are looking to bring forward for you for future GPC meetings, but would require a motion from this committee this morning to start putting those in the calendar for future meetings. As well as those future tentative topics, now would be the time, if the committee has any that they would like to see at an upcoming GPC, to put that on the floor for a vote from you all as well. And I think Councillor Perino has a topic that she's looking to discuss at a future GPC, if we wanted to ask her and any other members of the committee.
Councillor Perino.
Uh,
Oh, you just muted yourself.
I'm not sure. Sorry, thank you. Thank you, Chair. And Ms. Gurry may need to help me with the wording, but I would like to put on a future agenda the discussion around a bylaw that we have, that when a new building is put up, they are required to put a sidewalk, bike lane, either or both, and how that bylaw works. I'd like to know more about why we have it, the successes, possible changes to the future. I just want to have an understanding about how that works and if we could have a discussion about that in the future.
Thank you, Chair, and thank you, Councillor Perino. So yeah, our frontage works and services that are a requirement for new developments. I think Councillor Perino would like to look at our bylaw and our policy for implementing that bylaw at a future GPC and have the discussion around that.
Okay, do we need to have a vote on that, or we can just add?
Yes, please, we would like votes on any future topics, just so that you all, it's your agenda, so you've decided what you would like to hear, yeah.
So I have a mover. Do I have a seconder?
I'll move that. Yep.
Do you have a seconder? Mayor Krog. Any further discussion? Seeing none? Oh, Councillor Brown.
Yeah, the only thing I would add is I would love that discussion, but also if there's like potential advocacy pieces for changes around how monies can sometimes be collected in lieu of, rather than, I know it's something we've discussed before, but I actually think it's a pretty important piece to keep on top of and pushing for changes, so, thanks.
Any further discussion or comments? Seeing none, all in favor? And none opposed. Thank you. Any other comments about the agenda? Questions?
If any committee members have anything else they'd like to add, then please do, and if not, we do just need a motion and or any discussion on the list of tentative GPC topics before you.
Okay, so could I entertain a motion on the upcoming topics? Councillor Eastmer. Moved. Seconder? Councillor Hemmons. Any further discussion? Seeing none, all those in favor? Any opposed? Seeing none, the motion carries. Okay, the next is reports. This comes under Healthy Nanaimo, a supervised consumption site at 250 Albert Street, and this is to be introduced by Lisa Bhopal Singh, our General Manager of Community Services and Deputy Chief Administrative Officer. Take it away, Ms. Singh.
Okay. Good morning, Council. I'd like to introduce our topic for today, which is an update on the current use and role of the supervised consumption site at 250 Albert Street, and also the future of that site. We have with us today several distinguished guests from Island Health to present to us. This includes our incoming Chief Medical Health Officer, Dr. Tribesti Nguyen, Amanda Lemon, the Director of Clinical Service Delivery for the Addiction and Medicine Substance Use. They will be carrying most of the presentation with support from Dana Lake, the Director of Clinical Service Delivery for Mental Health and Substance Use, along with Julie Lajeunesse, the Executive Director of Addiction, Medicine and Substance Use, and then Dr. Rika Gustafsson, our Chief Medical Health Officer. So without further ado, if we could invite them to come and present.
Thank you, Ms. Bhopal Singh. So yes, please make your way to the microphone, and I'll let you decide who's up first, and if you'd please introduce yourself, I'd appreciate it. Thank you.
How do I control the slides?
Might want to pop that table up too. Yes.
Okay, great. You can hear me now? Okay.
Yes.
So thank you so much to the City of Nanaimo and to City staff for inviting us to speak to you today. So we'll be talking today about the Nanaimo and the unregulated drug crisis. So a little bit of information about the current situation and what's been happening, as well as some of the things that we're doing and what we may be looking to in the future. I won't introduce everybody. Our names are on the slides there, but I did want to make one correction, which is I'm the first person on here. I'm Dr. Nguyen. I'm not the incoming Chief Medical Health Officer. I'm the incoming Medical Health Officer. Our Chief, Dr. Reka Gustafson, is behind me, who will not be leaving us. Okay. So before jumping into the rest of the presentation, I just want to take a moment to acknowledge that we are meeting on the unceded and traditional territories of the Snuneymuxw First Nations today. And I like to take this moment just for myself to slow down and to acknowledge that I'm very grateful to be able to live and to work and to play on these really beautiful lands, and to acknowledge that where we are at today is a result of a legacy of colonialism, and to remind myself that there are nuances to our experience of the toxic drug crisis as a result of colonization, and the nuances in the ways that it impacts our Indigenous communities. So I just wanted to take a moment to for that. For the presentation today, we'll be speaking about a number of different things. So the first part of the presentation, I'll be speaking about Nanaimo and the unregulated drug crisis to paint a picture of where we're at today and how far we've come in the last 10-ish or so years. Then we'll talk about some of the things that we're doing about it. And so I'll pass it on to my colleagues to speak about the Nanaimo Wellness and Recovery Center after that. We'll talk about the number of lives that we've saved and the benefits and the impact of the interventions that we have in place. And then we'll talk about what may be coming up in the future, and then some time at the very end for a question and answer period. So the very first section of our presentation is, where are we at right now? Where are we in 2025 with this crisis? And as you all know, the crisis was declared in 2016, which means we've had about 10 years into this crisis now. And so I wanted to show how things have changed over the past decade and where we're at today. Now, it's going to be a lot of data. It's going to be a lot of figures in the next couple of slides. So I wanted to take a moment also to very briefly explain some of the measures and the indicators that we'll be showing. So the first thing that I wanted to explain is the difference between counts, rates, and annualized rates. I'll show this out in the figures, but essentially counts is just the raw number of, and I'll say, overdose deaths. So it's just how many times have deaths happened. The problem with counts, though, is we can't use counts to compare between different communities. So say, for example, we say there's 10 overdose deaths in Nanaimo, and there's 100 overdose deaths in Toronto. We can't compare those two, and we can't say that, Toronto has a higher burden, because they're pure counts. Toronto is obviously 6 million people, Nanaimo about 100,000. A larger community obviously will have a higher count. So the way that we can compare between communities is if we calculate a rate. And usually we express rates in terms of the number of deaths or overdose deaths per 100,000 people in a certain year. And so when we can calculate a rate and we say let's say, for example, there's 100 deaths per 100,000 people in Toronto, there's 10 deaths per 100,000 people in Nanaimo, then you can kind of say, okay, Toronto does have a higher burden. So that's what a rate is very useful for. Now the problem with rates is that if we calculate the rate for the current year, we don't have a complete year in 2025. We're only close to the beginning of November. We still have 2 months left to go. So if we calculate just the rate of 2025, we can't compare that with previous years, right, where we have a full year of data. So the way we are able to compare that is if we calculate an annualized rate, which uses what we have for this year, projects it for the entire year, and that way we can then compare 2025 with previous years. So I just wanted to explain that, and I'll highlight that out in the figures because it does help us to start to think about how we compare these numbers with different communities on the island in BC and throughout the different years in the past 10 years. Okay, so here's the very first figure that I wanted to show. This is looking at British Columbia as a whole. This is looking at the count of unregulated drug deaths and the rate per 100,000 people since 2014. So I want you to ignore everything on this figure except for the blue bars. And we can see that on the very far left is 2014. Each bar is a different year. On the far right is 2025. The blue bars give us the count of the deaths in BC every year. And if we just look at the blue bars and look at 2016, that was the year where we declared the emergency. And you can see that the years after that, 2017, 2018, we had an increasing count of deaths. 2019 was the first year that we did see a reduction. And then the pandemic hit in 2020. And then you can see the subsequent years after 2020, there was quite a precipitous rise in the number of deaths. 2024, you can see, is the first year post-pandemic where we've seen a decrease in the count of deaths. 2025 is a smaller number. Again, this is a count, so we don't have the full year yet. But, like I said earlier, we can calculate an annualized rate, and that's what the yellow bar is. So if you look at the yellow bar up there, you can see that in 2025, we are projecting on finishing this year out at another decrease. So we'll know at the end of this year better, but we are thinking that we'll end this year off better than last year, which would be the second year post-pandemic where we're seeing a decreasing trend. So our fingers are crossed that this is true and that we're in the right direction and that the services and the interventions that we're doing is making this difference. So now you might be thinking, okay, great, this is BC. This is the whole province. What does this look like at a smaller level? And so now we can take a look at island health. And so this is looking at the rate per 100,000 people by the different health authorities in BC. Each of the different colored lines is a different health authority. So you can see green is Northern Health, blue is the Island Health, red is Vancouver Coastal, purple is Fraser, and orange is Interior. So we can see from this figure that Island Health, the blue line, we're kind of right in the middle. So our experience here on the island is very similar to the red line, which is Vancouver. But we can see that far from popular belief, it's actually Northern Health that has the highest rates in BC. Fraser Health, the purple one, is the one with the lowest rates. And so Island Health is really kind of right in the middle of the province. So now you might be thinking, okay, that's Island Health. What about Nanaimo? What about our community? So this is now looking at the number or the count of unregulated drug poisonings by year in just the greater Nanaimo area. We're looking at 2016 on the left, all the way to 2025. So this looks pretty similar to that first figure that I showed in BC, which saw the post-pandemic trend. You can see from 2020 all the way up to 2023, we had that very large precipitous rise in Nanaimo as well. And then a decrease in 2024, and then another decrease in 2025. Again, this is a count only up until August, end of August, so we still need to see how this year will finalize. So we also have a rate as well for Nanaimo. So this is looking at Nanaimo as the blue line. The rest of the island is the orange line, and this is again looking throughout the different years. So just looking at the lines, we can see that Nanaimo is a bit worse off than the rest of the island. The rate in Nanaimo in the most recent years is about 2 times that of Island Health. It's about 2 times that of BC. I think the other interesting thing about this figure is if we start looking at the 2020 line, you can see that post-pandemic, the rate of increase, the rate of change of things getting worse was much higher in Nanaimo. You can see a divergence in the lines. So Nanaimo got worse much quicker than the rest of the island. We do see that decrease again starting in 2023, and that's what we're hoping things will land for this year as well. But this just goes to show, I think, how differently our community here in Nanaimo experiences this crisis than the rest of the island and the rest of the province. So you might now be thinking, how does Nanaimo compare to other communities on the island? And that's what this figure is showing. It's looking at the annualized rate of the different communities. And you can see that Greater Nanaimo is the second one on this. We have the second highest annualized death rate amongst all local health areas on Vancouver Island. We're only topped by Campbell River, which is that top circle. Nanaimo is the second one. So we have the second highest rate on the island. We can also break it down by neighborhood to take a look at get a sense of the burden that different neighborhoods in Nanaimo have. So this is taking all of the unregulated drug poisoning deaths in Nanaimo between April and August 2024, 2025, and then looking at how that cuts down by neighborhood. And we can see that when we do that, downtown Nanaimo has the highest proportion of deaths. And if you look at the percentages, we're just under half. So under half of all of the deaths in Nanaimo take place in downtown. The next highest neighborhood is Nanaimo South at just over 20%. And so twice as many deaths occur in downtown Nanaimo.
Dr. Nguyen, I'm going to just pause for a second. We have a question from Councillor Brown.
Yeah, thank you, Chair, and through you. I'm just curious, does the data ever distinguish between those that happen in someone's private home and like I'm just looking at these neighborhoods and, just knowing Nanaimo, and does it, those that are experiencing homelessness or transient in nature?
Yeah, that's a great question. We do have that data, and we do see that in Nanaimo, most of the deaths occur inside. They occur inside private homes. And so we haven't cut that data down to the neighborhood level, but we have looked at Nanaimo as a whole, and it's mostly in people's homes.
Okay, thank you.
Thank you. Please carry on.
So all of the data that I've shown so far is talking about unregulated drug deaths. I think sometimes, though, we forget that there are also legal substances that produce quite a high health burden in our community as well. And so I just wanted to highlight alcohol as one of them. This figure is looking at hospitalizations that are attributed to different substances. This is looking at alcohol, tobacco, and opioids. It's looking at 2007 from the far left all the way to 2019 on the right, so close to 2 decades of data. And this is Nanaimo specific. And so we can see that over 2 decades, the burden of hospitalization due to tobacco, which is the top line, has been decreasing. The burden of hospitalization due to alcohol has been increasing. And in 2018, alcohol actually outstripped tobacco in terms of being the substance with the highest burden of hospitalization in Nanaimo. The little circles on the right goes to show that Nanaimo is, with these substances, also a little bit worse off than other areas of the island and the province. Opioids is on the far bottom there. We can see that the burden of hospitalizations is lower for opioids than legal substances, but of course there's a bit of an increase again as we see during the toxic drug crisis. This is just very quickly cutting down alcohol hospitalizations by neighborhood, and again, downtown Nanaimo has the highest burden. That's the top line there. So hopefully that helped to kind of paint a picture of where we've come in the last 10 years, what's been happening recently and currently, and to paint the picture of how Nanaimo compares with other areas of the island and the province, and the neighborhoods in particular Nanaimo that are most impacted and are facing these challenges the hardest. So now you might be thinking, okay, what's happening? What are the things out there? What are the interventions? What are the services that are happening? So the Nanaimo Wellness and Recovery Center is an example of one of those things, and I'll pass it to my colleagues next to give an overview there.
Thank you. Thanks, Tri-Bestie. Good morning. Thank you for having us, and thank you for asking us to speak on the services that we are going to be implementing in the new year in Nanaimo. Many of you are very familiar with the location of 250 Albert Street, right next to City Hall, and the construction that's been occurring there. So the future vision and goal is a full wellness and recovery center in that location. And this will be co-located Island Health Services between addiction medicine, substance use, mental health and substance use, as well as the current functioning OPS will be located there. We've done lots of work on design and construction in terms of having alternate entrances and appealing to a broad demographic of folks who are using substances. There is construction well underway, so we appreciate that everyone has been patient and certainly the operator of the OPS as they've had to pivot and alternatively provide services while the construction is ongoing indoors. We expect the construction to be done early to late spring. And then we're finalizing and working with our teams and services to grow the capacity, determine which other partners within Island Health we're going to work with at the site to provide fulsome service to community. And I'll pass it over to Dana to speak about the teams that she supports that will be entering the space.
Thank you, Amanda. Good morning, and thank you again for welcoming us and providing the opportunity to speak. So from the mental health and substance use side of service provision, there will be two teams that will be co-located at 250 Albert Street, and the first one is the Substance Use Service Outreach Team, which is a long-standing team here in Nanaimo, most commonly known as SUSO. And so this is a multidisciplinary care team. It's comprised of a variety of care providers, from nurses to social work, peers, as well as primary care and addictions medicine. This team operates currently out of the Wentworth location, but you will find them mostly out and about on the streets with their orange jackets and providing services and meeting people where they're at. They also provide connection points for people who are interested in other options around their recovery. So connections to treatment referrals, connections to other recovery supports that people may be interested in. The other team that will be co-located there is the primary care outreach team. Again, another longstanding team that was stood up at the time of the pandemic. And this is an incredible team that you probably also see out and about. We have a van attached to that team, and this is, again, a multidisciplinary team that's made up of peer specialists, outreach support workers, nurses, physicians, and social workers. And so they will have a landing place at 250 Albert Street, but will continue to provide that outreach support in our communities across Nanaimo.
With the addiction medicine, there we go, I'm loud. With the addiction medicine and substance use program, we are adding a RAC service to the site, so it's a rapid access addiction clinic. This folds under the Road to Recovery, the provincial Road to Recovery umbrella. There's only one other Island Health operated RAC on the island, which is in Victoria currently. This team, again, will be multidisciplinary with nurses, seeking to have nurses who will have certified practice in opioid use disorder prescribing. We will have addiction recovery workers, peer support workers, hopefully as per our recruitment strategy, nurse practitioners and physicians who will be available 7 days a week. The RAC will operate very much through a walk-in type service. There will be obviously space for booked appointments for people with follow-up. The goal with a service like a RAC is to divert people from emergency rooms who are requiring support with their prescriptions or missed doses, different things like that, so that we can divert some of that traffic back to the clinic. There are clinicians on the team as well who, along with the SUSO team at the site, they'll work very collaboratively together. There are spaces for counseling or group work and treatment applications. We have access to different levels of supportive substance use beds throughout Nanaimo and the island as well. So that's the piece about the RAC. It's a new service for us, so we're excited about it and going to be learning a lot as we build this team and service at the site. overall, I think it's really important to notice the site will have, Dana's teams will still provide outreach to the community. There will be space for folks to come in and receive those services. So we intentionally designed the space with primary care type exam rooms where wound care can happen, NPs and physicians can see the people that they support. We have also intentionally added IV treatment areas, so hopefully down the road we can again divert some of the emergency room visits and ambulatory care use up at NRGH to a more accessible space in a different location. So lots of grand plans, and the space will allow us to do a lot of that. Again, basically for a RAC, these are the types of services you see that a RAC provides, but all of the teams will work collaboratively together, I think, at the site for anybody who's coming in. And again, historically, a lot of our teams and services have functioned in an outreach capacity, haven't had space for people to come to. So this is a new opportunity for people to come to the space, and we have intentionally designed the space with different entrances and exits. So the OPS will be on one side with drug checking services, and then the rest of the kind of wellness and recovery services on the other side with different entrants, so that we're hoping a broader demographic of folks will feel comfortable coming and utilizing the services there. And I believe I'm passing it back to Troy Bestie.
Yeah, thanks. And so with the OPS in Nanaimo, we also have data on how much it's being used. So this is a figure just showing the number of visits to the Nanaimo OPS over the years. The key point really is on the left here, which is since opening in 2017, there have been 160,000 total visits to the OPS. The OPS, of course, also provides supplies, gives out information, it gives referrals to treatment as well. So a lot of things happen out of there. So this is just taking a look at the number of those supplies, referrals, information that's given out. And so the key point here is on the right. Since opening, about 270,000 supplies, information brochures, referrals have been made through the center. And then finally, this is looking at the number of naloxone kits that are distributed through the OPS in Nanaimo. Naloxone, for those who don't know, it's a medication that reverses opioid overdoses. And so key point here is on the right. Since opening, about 23,641 kits have been distributed to the site. Okay, so we've talked now a little bit about some of the services, not all of them that are obviously out there in the community, but some of them. And so the question in our minds might be, well, what difference are we making? What's the impact of these services? And so we have data to show that as well. So this is looking at the lives that have been saved, or in other words, the deaths that have been averted. So the figure is looking out throughout time, and it's looking at different interventions. That teal line is take-home naloxone. The yellow line is OAT, or opioid agonist therapy or treatment. And then the purple at the very bottom is the OPS, the overdose prevention site. And so this is through a PhD mathematical modeling that has shown to us that of 2,330 potential lives that would have been lost if there were no interventions in place, with just these 3 interventions, we were able to save 1,960 of them. And this is just in 1 year. So this is from July 2024 to July 2025. This is Island Health wide. But I just wanted to take a moment just to acknowledge how amazing that is. You know, it's 1,960 deaths that were averted just from these 3 interventions. This doesn't even account for all the other things that happen out there, counseling, detox beds, withdrawal management. It doesn't count for any of those things. It's just these 3 interventions.
I'm going to just pause you for a second. I have a question from Councillor Brown. Go ahead.
Thank you, Chair. Just a quick question. So are these like unique individuals? Doesn't it excludes?
That's a great question. So it does not count unique individuals. It counts events that would have led to a death. So one individual may be counted multiple times because they could have overdosed multiple times and then been saved multiple times.
Okay. So then it's not 1,960 were saved. It's,
Deaths were saved. Yeah, great distinction that you're making. Yeah.
Thank
Yeah.
you.
Not individuals, it's events.
okay, thank you.
Mayor Croak.
Thank you very much, Chair. When it refers to observed consumption services and that a death's been prevented, what does that mean? Does that mean that the drugs they brought in were tested and determined that it would have been deadly if they'd taken them, or was it that they overdosed on site taking those drugs? What exactly does that term mean?
Yeah, that's a great question. So I don't know the complete nuances behind the modeling for this. One thing I can say is that one of the data sources that take into account are the observed overdoses within an overdose prevention site. And so if you see someone overdosing and you respond to that, that might be counted as one of those events.
I'd appreciate the response down the road that indicates exactly what that means. With great respect, you know, Churchill's line, lies, damned lies, and statistics, and I love statistics, but having said that, unless I have a definition that I can understand as opposed to the language that may be used in the medical community and the wider audience in the NIMO, it's not going to have much impact on people if that isn't explained fully. Thank you.
Yeah, thank you for that feedback.
Any other questions? Oh, please continue, Doctor.
Okay, so when we calculate that into a proportion, it's 84% of deaths that have been averted in that 1 year. So this experience is also found within other jurisdictions that have published evidence as well. So I just quickly will say that decreases in mortality rates within the neighborhoods that surround overdose prevention sites have been found in other communities as well, so including in Vancouver, which is really that top line there. The second line is the experience in Toronto. And then the bottom line there is a study that looked at not deaths, but it looked at public use, discarded syringes, litter, etc., around overdose prevention sites. And so in Vancouver, they found that when they measured it before and after, there was a reduction after the OPS had opened. So now you might be thinking, okay, what might be some of the things that are coming? So I'll pass it back over to my colleagues.
Thanks. I think we may have spoken to this a bit, but I alluded to the timelines for the Nanaimo Wilson Recovery Center. The construction is well underway. We have weekly construction meetings. The clinical teams are working together to develop the services that, there's services that already exist, but the services that we're building there. So again, well, hopefully late May, as we all know, or not May, late spring. As we know, with construction, there are different things that occur, but that's the goal as we move into the summer. We also are broadly throughout the region working under the Road to Recovery, Provincial Road to Recovery umbrella with multiple different initiatives. So it's very timely for the Nanaimo Wellness and Recovery Center in that we will have some increased access regionally to withdrawal management beds. We're working on those spaces and different substance use services throughout the continuum and highly bed-based, so supportive recovery, stabilization, and then further treatment. As you know, we're developing a treatment center just in Oceanside as well. So there's quite a few initiatives that are ongoing, and including greater access, Access Central, which will hopefully help us provide some more equitable access to acute withdrawal management and subsequent bed-based services throughout the entire health region. So it's a large project, a lot of work that's ongoing, but it's all well underway. And then, you know, consistently we're meeting with our community partners and operator of our overdose prevention services in looking at what we can do in the area. It is a challenge right now with the construction for sure, but we are meeting with city staff, and that's the goal, to continue to work together to try and mitigate any risk to community like Trivesti was saying, if we don't have an overdose prevention service, there will still be, and probably a highly greater number of substance use in the community. So we want to do everything that we can to support the service to operate in collaboration with everyone who's working and living around the area. So.
And, yeah, and so this is my last slide. This is really a selfish slide in the sense that I'm new to the community. I'm new to this role, and so really, just a point I think for me to say that I think we have the same goals for our community. We both want to see our community as healthy and well and thriving as much as possible. That's my goal as well. And so as I'm coming into this role, really just a selfish commitment or an offer maybe to work together with you all on achieving that goal. And that is it. These are just citations, and then I guess we'll open up for questions now.
Questions from council? Okay, Mayor Krog.
Thank you very much, and maybe I'm just getting cynical and saddened, and I'm not laying blame on anybody. Collectively, the failure to respond to this so-called crisis, when it's lasted for 10 years, it's not a crisis, it's become the norm, and let's not pretend otherwise. Having said that, when I look at the statistics, and it's page 20 of ours, we're at the unregulated drug deaths and death rate per 100,000 population that peaked in 2023 and is dropping now. How do you respond to the cynical observation I hear from many people? The reason the death rate is dropping is because we've killed off the vulnerable population through our neglect, and the death rate is dropping for that reason. And I say, how do you respond to that cynical observation?
So, thank you. So that is one of, whenever there's what we call an outbreak, there comes a point where the number of vulnerable people is reduced. But we also have data on the number of people suffering with opioid use disorder in our province, and that while it's been relatively steady, it has not dropped in a parallel fashion to the number of deaths. So the number of people at risk remains quite steady. I think what we do need to acknowledge is that the greatest driver of deaths is the composition of the drug supply. And we don't have any influence on the composition of the drug supply. We do think, if you look at the trends, we do think that these interventions were put in place when the overdose emergency was declared. There was actually a substantial decline in deaths in 2019, and then the pandemic was declared, and there was a precipitous and immediate increase in deaths, likely related to the withdrawal of those services or the restriction of those services, followed by the drug supply becoming substantially more toxic. Now many of those services are expanded and put back in place, but there is a big factor that we don't know, which is we only have very limited insight into, which is the composition of the illegal drug supply. We know that between 2019 and 2023, the concentration of highly toxic drugs increased substantially. But this is a drug supply that changes all the time, and we really don't have very much input into what happens to it, and that's our biggest driver.
Okay.
Councillor Eastmere.
Thank you. Good morning. Thank you for the presentation. I was wondering if you could elaborate on what the plans are around what the expanded services and expanded hours might look like in order to better serve the needs of people who are accessing that site.
Yeah, sure. Well, I don't want to speak for Dana's teams, but they already do work quite a significant extended day. So the idea for the site to be operational 10 to 12 hours a day with staff on site. So hopefully having fairly open access in the early morning and for after work crowd to try not to exclude anybody. It's not an overnight service. These are daytime services and teams and physicians and allied health staff. So 7 days a week. The outreach teams currently operate 7 days a week. In some locations, access to addiction medicine services is very limited to maybe 5 days a week. So regionally, we're expanding our virtual care or creating virtual care capacity as well. And this service alongside would have 7-day-a-week access. Again, this is all based on recruitment and retention strategies, which we are really working on. But as many of you know, with the teams and services in Nanaimo, there's a bit of a finite number of staff that work on throughout the mall. So we're really trying to create some energy and atmosphere around this service so that people want to come and work there and welcome people in.
Okay, appreciate that. So recognizing that there's staffing challenges, it's not easy to just add these services. You have an issue with actually being able to staff those hours.
Yeah, we do. Well, we haven't posted all of our positions or anything like that, but we anticipate that. So we work with our HR and recruitment department about that. Just as I alluded to before, we are launching several different services throughout the region, and we don't want our regions to be competing with each other for nursing staff. And you know, we want to be able to sustain a 24/7 site in Oceanside really well. So the good piece about it is how our clinicians work in multi-teams and collaborate really well that way, and we do with the other programs. So, yeah.
Thank you. If I may, so you mentioned a 24/7 service in Oceanside?
That is the Oceanside Treatment Center.
The Oceanside.
So it will be staffed overnight, which is just inherently more challenging.
Do we have something like that in Nanaimo?
We do not.
We do not.
That's a regional service. So, and that is full bed-based treatment. So it's adding treatment beds to the continuum of substance use service throughout the region. So people living in Nanaimo will have access to that in an equitable way, as do others throughout the region.
Thank you. And if I may,
Yeah, go
I'm just, I guess, what led to this conversation today is, among other things, is some of the concerns that we've witnessed around the activity around the supervised consumption site and, for example, around City Hall. I didn't really hear any acknowledgement of the sort of challenges that we've been experiencing during this presentation. And so I guess I would be also looking for first an acknowledgement of the impact that it is having on the area, the work that's being done to help mitigate that, and how Island Health might be able to work better with the city to ensure that our staff feel safe coming to work early in the morning and leaving work late at night from City Hall when the supervised consumption site services are closed, but people are still in the area, because there's just a lack of services for people once they access the supervised consumption site. And I'm just wondering, like, will these new services allow people to be able to remain on site and receive other supports that they may need instead of instantly sort of dispersing into the neighborhood?
The services that are adding are not meant to be a drop-in or like replacing the hub or a space where people come throughout the day. They're medical health services, so people can come in and receive treatment, prescription, work on whatever primary care challenges that they might be facing. And yes, they would have appointments or walk in, and then they would go about their day. Ideally, they might come in for several hours if they have a specific treatment that we are providing at that site, but it's not an overnight service. It's not a drop-in type of social service. They can receive consultations, access, referrals to all the different types of treatment that might be available to them. But if you're talking about like a space where people can go kind of throughout the day, all day, that's not the basis of this service. It is highly health-based with, you know, like I said, physicians, nurse practitioners, etc. So in terms of, sorry, what was the other part of the question?
The first part was about,
Just the
acknowledging
area and how
the impact
challenging.
and how we can
Yeah.
be a partner to decrease some of the concerns that people have.
Yeah. And I'm sure you've heard from city staff. We meet very, very regularly. Dana can speak to her outreach teams who have nurses going out with the CSOs on a very regular basis, and hopefully, creating intervention in those areas. The actual parking lot there, I think, is what you're referring to beside City Hall, and just that there's congregation around there. It is a multi-layered effort between, Island Health. We aren't currently occupying the building, but we work with the operator of the building and work with the city. So our goal is to see if we can find some, quick wins, quick interventions that we can do to support the area by meeting with our operators and health teams and the city staff.
And I also would add that I think with that co-location model of our, the blended teams being physically at the space, so much of the work is relational with the population. And so having more Island Health staff and connections and people who have those relationships with individuals, I think will be a step in also contributing to the mitigation of any sort of congregation or fears or concerns in that area, because there will be opportunities for connection points that are already established with these outreach teams, but they'll all be centered in the same location and be able to connect with people, move them to other areas where their service needs might be getting met, whether it's at a medical clinic or food security, those sorts of things.
And I think right now, for those teams that provide service, they provide service primarily outdoors or in reaching into supportive housing locations or shelter spaces. So this is different in that it is a health space that will welcome people indoors to do some of that care and service, where it has traditionally occurred, or over the last few years, primarily in outreach capacity.
And I just wanted to also take a moment to say that we hear you, and we acknowledge those concerns, and that those are real concerns that you're experiencing. And I guess one thing I want to say is that we take that very seriously, and that we have those conversations internally to plan how best it is that we can approach that concern. But also wanting to welcome if there is a better way for us to work together on that, we're open to that conversation too.
I would also add as well that once we have some of our teams and services there, we will have Island Health leadership as well there, which does have an impact in who you can connect with and how we can support the environment around the building. So perhaps my office space would be there, or others that in the community who work in leadership and are very connected to city staff, to the CSOs, to the bylaws, and so I think that will have an overall positive impact as well in relationship between the different businesses and folks in the area for the people that we're serving, and then as leaders you will know who to connect with and those kinds of things in the site. So we also want to have a highly functional site that has minimum impact and keep it very safe and open for people to want to come into service.
So really, not a lot to add to that, except that definitely this will be an enhanced service that contributes to stabilization of individuals through meeting their health needs. And we are going to have to continue to work together to address the other issues that are impacting this, which is housing, somewhere to gather. I think one of the things that we really need to recognize is that we're talking about human beings who are looking for community, somewhere to be. And if there isn't somewhere to be, then they will be on the street. And so I think it's really important to think through what are the contributors to this. And I think there will be definitely an enhanced contribution to the health services that individuals are receiving. They will likely be more stable. They will likely be able to access a broader range of services that they need. And then I think we need to work together and assess the situation then, and what contributions we have made, and then what is left for us to work with. And the kind of things that your experiences, of course, happen in multiple places in Nanaimo, multiple places in Vancouver Island, multiple places in British Columbia. Some are close to services, some are not. And this, absolutely right. I think very much welcome the opportunity to learn how we can work better together. I think this is a step forward. I don't think any of us think it's going to be the entire solution.
Thank you. I'm going to pass the next question to Councillor Brown.
Thank you, Chair. I don't think I said it before, but thanks for being here and having, I really appreciate kind of having the numbers and being kind of walked through them, and that's very useful. With respect to, I think, kind of building off of his worship's question there, you know, the unregulated drug deaths and the rate per 100,000 population, you know, it's very interesting to see the impact of COVID on that, or the pandemic, and maybe not the pandemic itself, but some of the measures and how that's played out. A question kind of emerges for me here, though, is maybe this is just one half of the important data. So it shows that obviously policy interventions and very practical operational interventions are helping save people's lives from overdose. What does the data show on those risk factors, and is there policy mechanisms in place and interventions happening that are reducing the amount of people that might find themselves on drugs because of their high risk factors or their life circumstance, or once they have an opiate, they are on opiates, what's the kind of data show us the intervention helping people on their path to recovery? Is it a good news story, or is it sort of waiting to be seen?
So I think that's a really great question, and I think a very difficult question, I think, to answer. I think what I would say is that our approach to the toxic drug crisis has to come from multiple different angles. So what I presented on today in terms of take-home naloxone, right, the overdose prevention site, those are harm reduction strategies. And what really those things are really great at doing is saving that person's life at the point of death, right? Take-home naloxone literally reverses an overdose, right? But you're right that how do we prevent people from falling into the stream that causes them to use substances for whatever reason that end up in that point of death, right? And so treatment is one thing to remove someone from the stream, but that doesn't prevent someone from falling into that stream, right, in the first place. And so the other multi-pronged approach to this is prevention. And so we know that there are certain experiences, particularly in childhood, that increases the risk for someone to fall into that stream. Traumatic childhood experiences, for example, feeling like you don't belong to the community when you're a youth, for example, not having strong connections to an adult figure, for example. We know that these are factors in childhood that increases the risk for someone to fall into that stream. And so one of the ways in which we can prevent this road is really focusing on that, really focusing on youth, really focusing on promoting, those positive childhood experiences. In the long run, that will prevent people from falling into the stream. And that's just one example, right? I think when we talk about risk factors, there's many other things. We know poverty, for example, is another risk factor, and so that would require another approach as well. But I think your point is really well taken in that if we focus only on harm reduction, if we focus only on treatment, we're missing this other piece, and people will continually fall into that stream, which is why Dr. Gustafson was saying that the amount of people at risk in the community is not really quite changing.
And just to add a little bit to that, I think it's an excellent question, and we don't talk enough about prevention. And some of the things that Dr. Nguyen mentioned are actually in the purview of governments, which is creating communities or supporting communities where connection can occur, where participation for youth can occur, and mentorship for youth can occur. All of those are incredibly important. Adverse childhood experiences are counteracted by positive childhood experiences. The evidence is really emergent on that. One of the strongest and most evidence-based interventions is access to universal high-quality childcare. The other is social housing. Those are both important interventions that actually reduce the likelihood that people will find themselves with an addiction. I think your question is also a really good one. Is treatment making a significant difference? One of the things that is, despite increasing numbers of prescribers, that is somewhat concerning is that the number of people on OAT is really quite stable. It's not increasing in proportion to the services we put in place. The other is that a lot of, or at least some of the addictions that people are dealing with, such as stimulant use disorder, doesn't actually have a particularly effective treatment. So one of the things that that I think we really need to acknowledge is that treatment it's not an antibiotic. It's not. It's a complex, relapsing condition that requires significant intervention. Some of which has good evidence for efficacy, other which is really doesn't have good evidence for efficacy, and the condition is changing with the drugs, because an opiate use disorder that's complicated by benzodiazepine addiction or dependence is a very different condition. And so I think that's the other thing is, and I know this is often a controversial topic, and I feel like we need to come together on is how are we going to address the drug supply? Because this is, what we're seeing is not seen in other places where the drug supply looks different. And it's a complicated, often very heated topic, but it's something that I don't think we can forget about.
Yeah, thanks so much. Appreciate it.
Councillor Gesselbrock.
Great, thanks, Chair. Through you, thanks so much for the presentations and the information. Really appreciate you taking the time today. I just have some questions with it's always surprising to see the number of folks dying and then hearing that, the majority are at home, more isolated. And with the numbers with the OPS, do we have any data on like individuals that are like street entrenched or living in homelessness compared to folks that do have a place to stay for usage of it? Excuse me.
Yeah, thanks. By nature, the OPS service holds some anonymity towards it. Sorry, it's Halloween. And so not a lot of demographic information is collected when people are in and utilizing the service. It's pretty, raw data in that, how many visits, is this a unique user of the service? Was there an overdose reversal or intervention? Anecdotally, some of that is collected because there's so many different interactions that occur within an OPS. That's kind of the beauty of OPS services, is that relationship is created, trust is built, and different service providers can come in, meet with people in the space if it's available, and or the people accessing service connect with the operators of the service to then seek out further service. So it's not officially collected in the data that would go to, say, our medical health officers, but there is an ability to capture some of that data. And we'd have to meet with our local operator to learn more about specifically Nanaimo. I could say what I think anecdotally, but I probably won't. But yeah, so they could speak to, are there people coming from private residences? Are there people coming kind of after their shift work? That is known. It's not captured in such a way.
Okay, great. Yeah, I just like looking at the reversal of deaths stats, like the OPS intervention, it's like very consistent, at a certain level, and it could look like there's a high servicing of folks that are homelessness, street entrenched at that location.
Yes.
And as a point of contact for health services, I think very important. It's just bringing back the whole, like, what are the best strategies to support that group in terms of helping them move into housing and supports. And like, there are some things, I often come after hours to pick up my mail from City Hall, and it is quite striking. Like, there's a huge group of people sitting there. There's always like very suspicious individuals, in a nicer vehicle that are hanging out, and you can see like the drug interaction and just the access to supply. And when there is a concentration in a known repeated location where people can be, we're seeing that at the hub, it almost feels like it increases access to a certain type of supply that's like dangerous. And I'm just curious, like, how much work on the supply end of the drugs and limiting that, or the effectiveness of that, happens, and does Island Health advocate to addressing that end? And I know it pulls in corrections and all these other systems, but I sometimes feel it's just like we're throwing so much resources at this issue, and like, really, we can keep people alive, and that's what we're doing. And I think there's an exasperation of like, what else can we do to be addressing this issue? Because it seems like we're putting a lot of resources at keeping people alive and then increasing the treatment end of stuff. And as you say, that's only has so much effect, but like, where is the pinch point that we can focus on to leverage to like address that? And is it on the supply end? So I'm just curious if there's any comments on that.
There's a few things that kind of weigh into that, and I think just you're talking about congregation and space, and having overnight spaces for people to go to is really important. This OPS is open later than the majority, or I think, of all the OPSs on the island, so it does serve people later into the evening. The other piece about, kind of working towards supporting people to get to a place that has some more stability. The hope is, with having some of these more health services a little more regular and accessible at this site too, that some health stability can occur. Success and moving on to temporary or transitional and then permanent housing is really challenging when your health needs are not fully met, and it's a day-to-day kind of battle. So stabilization of any piece, and any way we can support somebody in stabilizing any piece of their life, will help. In terms of, the action and things that are going around the OPSs and the belief around that, we do meet with RCMP very regularly. We have regular meetings with our leadership, RCMP leadership, and local operators in majority of communities that have OPSs, and specifically we do that for Nanaimo as well, to pay attention to what's going on in the locations and the sites. So that's another piece, and I think probably city staff, I can't, if your director of public safety is there, but I think he is, but as well. So
great things. Yeah, sometimes does it help? It's like, at the hub or at the OPS, we know that people are bringing drugs to this location and dealing. Like, is it useful and dealing with the people that are dealing to reduce sort of the access to the opioid, or is there just such a huge demand that it doesn't matter, because there's such a huge demand, there's always going to be somebody else willing to sell? And I guess the question is, like, is there any like data on switching people, like transitioning folks from, the toxic drug supply and like the fentanyl use to opioid agonists, and like numbers around that, and like, are we making any headway kind of switching people from using these sort of the street drugs to, a more medical pathway to treatment?
So we don't have that data today, but of course that's the goal of opiate agonist therapy. And one of the things that I can say, again without numbers, and we're happy to provide the numbers that we have, but is that the opiate agonist treatment changes all the time as well to respond to the changing drug supply. So our physicians and our clinicians are always expanding their repertoire to ensure that that there is a successful transition to treatment, and it does continue to occur. So I do want to say that even with the highly potent drug supply today, the opiate agonist therapy options are stabilizing people, and I'm happy to go back and provide some numbers on that for you. So I want to just emphasize that with wraparound services, with the appropriate medications for people that address the degree or the strength of the of the drugs with which they are using right now, there is success in transitioning people to, continued success in transitioning people to OAT. And the more wraparound services we have for people, and the more we can meet their dependence needs, the better we do. But that's numbers that we're very happy to work with your staff to bring back to you.
Okay, thank you. Just one more final question, if I may. In terms of what would be useful for council to advocate for, like, I think there is sort of feelings that's like, without addressing sort of the supply, and we're just continually treading water, but if increased treatment and detox is something that would be useful, like, what can we be advocating to the provincial government for? I know I don't want to put you in a tricky situation, but like, what should we be asking for to decrease the number of people that are on the street, and sort of, in that environment where there's a lot of social disorder, and drug use, and sort of this continually festering situation, because we're advocating a lot for housing, people think we're advocating for the treatment and detox. Is there anything that we're missing, adding our voice to it to improve the situation?
That's a really great question, and I just want to go back to, I think, what I mentioned earlier around prevention. I think when we think about this crisis that we're in, we're quick to come to solutions that are, at the point of death, or pulling somebody out from the stream. But if we don't focus on prevention and preventing somebody from going into this pathway in the first place, we're never going to solve this problem. And I think we don't, and I'm guilty of this as well, of immediately thinking about how do I save a person at the point of death, right? Because it's a little bit more sexy to think about it that way. But the hard work is the prevention piece. And the other hard thing about it is that we can put as much resource as we want into prevention, but we're not going to see the impact of that until decades into the future. We're talking about the life course of a person. So, and that's, I think, a part of the reason why we don't invest enough into prevention, is because we don't see the results of that work until well into the future. But that's the work that needs to happen. Otherwise, we will continue to have people who will be at risk. We will continue to have people who will fall into the stream. We will continue to have people who will struggle with this, and we will continue to have people who will die from this. And so that's, I think that's something that we need to take a whole societal approach to, is prevention. And that's something I think that, as local government, there's a place for that.
So seeing a magic bullet in terms of decreasing the social disorder is not something that a realistic expectation, but really we need to be really focusing on, like, because we see growing social inequity right across Canada. Nanaimo is one of the highest child poverty rates. There's the largest demographic next to boomer bliss, well-to-do baby boomers, is struggling young families in Nanaimo. And that needs to be messaging that we need to be putting out there in terms of these larger investments in sort of our social infrastructure, education, housing. Thanks.
Yeah, and you won't see the change tomorrow with that type of work, right? That is something that you will see the change well into the future, and so that's the crux of prevention work.
Perhaps just the one thing, if I may add, is in addition to those interventions in early childhood, I do think we need to acknowledge that there's also a cohort of youth and young adults who've experienced the pandemic in a very different way. There has been a significant disruption in education, a significant disruption in employment opportunities. Youth unemployment hit 14.7%, I believe, in September, which is the highest since 2010. And so I think one of the really important interventions I think we need to do is not to forget about that cohort. And what are the ways in which we can, we don't often think about that cohort as vulnerable, but how can we put together opportunities to participate in government, in society, in employment, in education, for a cohort for whom that's been truly disrupted. And so that's just in addition to many of the, I think, the social determinants of health that we need to focus on. Just a couple of things. I do think it's important that we don't take the foot off the gas of Road to Recovery. That is an investment in a system of care. And then I do think we need to have a different conversation about how to address the supply, because it does look different here than it does in many other parts of the world, and it is an immediate driver of what we're seeing today. It's very complex, so I think I would just really second what Dr. Nguyen was saying, is that really investment in the things that drive vulnerability to addiction is the long-term solution.
There are no silver bullets, only silver buckshot. It's a multifaceted and complex problem we face in society. Councillor Hammonds.
Thank you, Chair, and thank you to the presenters for being here. Most of what I would have asked or commented on has already been asked or commented about, so I won't repeat. I do want to emphasize Councillor Eastmere's comments that the impetus for today's conversation really was, I think, a very frustrated city councillor who sees city staff coming to work and being afraid to get out of their cars. So that's just a reality. I really appreciate what you guys do in the building and that you're enhancing services and resources within the building. I think, again, the conversation that we're centered upon is the spillover. So, Dr. Nguyen, congratulations on your appointment. A welcome to Nanaimo. You asked for specific ways we might partner. This is a bit cheeky because I know you can't answer, but I understand that City is contemplating security services. Is that something that the Health Authority would partner with us on? And I leave that with you, as you're welcome. You look like you might want to answer, or you're welcome to just take it away, just as a really tangible piece of something that we're dealing with, ensuring that our staff feel safe, which is important. That could be at significant cost to taxpayers coming up shortly. I don't see any hands going up, so I'm just going to keep going with a couple of really specific questions. So 160 visits to the OPS, that's significant and like well done for meeting that need. Do we have numbers on the actual number of visitors? Like, what is the ratio?
Do you mean of like unique individuals? I don't think we have that. Not today. Of unique individuals. Yeah. Oh, do you want to?
Okay.
Oh, okay. That we'd have to go back and take a look at that again. Yeah.
Thank you. That would be an interesting stat. Regarding the construction on site, we've experienced at City Hall and the surrounding neighborhood an increase in, I would say, challenges. Do you think when construction is done and the service is a bit more open, that those would be somewhat eased? I notice there's heavy equipment in the parking lot right now, and I'm wondering if what we're experiencing at City Hall is related to the service next door can't actually accommodate a lot of foot traffic right now.
I mean, anecdotally, I would say yes, it's disruptive for everyone. It's disruptive for the service provider. It's disruptive for the surrounding community. It's disruptive for the people who are coming in to access service. So I do think there will be a significant improvement in the area and how people are supported around the area. We will have quite a number of staff as well in the building, coming and going from the building, and just more people around to engage with people in the area. So, as we look towards opening, we'll work with City and maybe a little community advisory about how we're going to collectively operate in the area, and we'll be neighbors and work to figure that out. But I'm assuming there will be a pretty significant improvement. It's very crowded where it is now. Yeah.
Thank you. A quick question about brain injury. I understand from the Nanaimo Brain Injury Society that for every one death, we see 15 people with anoxic brain injury. Is Island Health, what is the protocol there for the people who are being, reversing the drug toxicity and coming back through the use of naloxone, but are coming back with maybe diminished ability to make reasonable judgment? We know that brain injury increases within the amount of time down. We're seeing people down all the time. So I'm being really inarticulate and ungraceful in this question, but that seems there's a ton of resources going in towards preventing the deaths, but the people who their deaths are prevented, that's wonderful. How are we supporting them?
So you're naming one of the emerging health issues that we are dealing with, and one of the things that I would just want to acknowledge is that many of our currently existing medical services or supportive services don't meet the needs of people who are experiencing that. So just what I can say is there's a lot of conversation about how do we design the services that meet the needs of these individuals, because they are different. They're different than long-term care, they're different than acute care, and different than the existing complex care services. So it is actually what we're referring to as an emerging patient population for whom we actually have to design different services. And there have been a number of attempts, and I think some of them work better than others. But we're not at a place where we have designed the kind of service that this patient population needs. And it is, I just want to acknowledge the reality of that, and that is something that we're working on. I don't know if you want to add anything, Dana, or...
Okay, thank you. I just want to acknowledge sometimes these conversations feel that they can be set up antagonistically, because everyone's doing what they can within the resources and that are available to them, but everyone still experiences some of the chaos. So I just want to say thank you for how you guys are showing up today. I really appreciate it, and I really appreciate this dialogue. Thank you.
Thank you.
I think, and if I may, just wanted to comment on, you had a question about that security piece. I don't think we have an answer to that, but I would just say that I think I invite conversations, I think, and, to sit down and take a look at what that looks like, and take a look at what other things look like as well, and then we can go from there.
Thank you.
Thanks. Before I go to Councillor Eastmere, I've got a couple of questions myself, and first of all, I want to thank you all for being here and taking time out of your day. I really appreciate it. We've been talking about opioid agonist therapy, and I understand what methadone and Suboxone and those things do, but I think there's a lot of confusion in our community about the opioid agonist therapy, and also about free drugs and safe supply. And I think right now there's really 4 clinics plus Island Health that are providing opioid agonist therapy, and those 4 clinics are all at 55 Victoria Road, and that's where the main clinic is as well, for people to get those prescriptions after they've been to those clinics. And I'm just wondering if you could just discuss that a little bit about what opioid agonist therapy looks like for people that are getting it, and what is the percentage of safe supply that's going into the community, as opposed to people, when they're using the OPS, using unregulated street drugs.
I can start. Yeah. So I think, I'm so glad you brought this up, so thank you for the question. I think safe supply is a misnomer, actually. And I think there's this sort of misperception that when I go to Ontario and they say, oh, well, BC has rolled out safe supply. No, we haven't. We've had all medications, whatever those medications are actually provided by prescription. And so to me, everything that we're providing is actually on the spectrum of opioid agonist therapy. And there are, as the drug supply has changed, as the medical condition of dependence and addiction changed based on the types of drugs on the street, the medications that are provided have to change quite rapidly to meet that need. I believe at the height of, and I'm now going to make a number up, but I don't think I'm completely making it up, is I believe at the height of what we call prescribed safe supply, out of the 125 to 200,000 people in British Columbia, I think about 5,000 had access to that. So it's always been, but whatever you call it, a very, very small proportion of people who have access to what was called prescribed safe supply. Now we call it prescribed alternatives, largely because it's probably simply that the evidence base for their use is not as well established as OAT, as methadone, for example. But that would be I have addiction medicine colleagues who can probably answer this question much more precisely. But I do think that that the word safe supply is telling something to the community that it actually doesn't exist. All medications are provided by prescription.
It's a misnomer. There's no such thing as safe fentanyl unless you're at the hospital and they're giving you a dose after surgery or.
No, some people are receiving forms of fentanyl as patches or sublingual as an opiate agonist therapy. But if you think about what opiate agonist therapy is, it's an opiate that attaches to the receptors to respond to the physiological experience of withdrawal and craving. So and again, I have addiction medicine colleagues who can say those things much better than I can. But I do think it's really important to address that because what's in a name? And I think people believe there's a perception that true safe supply has been rolled out, and it really has not.
Okay. So in terms of the opioid agonist therapy, that's something that's happening at the OPS site and at these other 4 locations at 55 Victoria Road?
Not at the OPS site.
Okay.
It is again a prescription and provider, and so the person would work with their pharmacy, local pharmacy. If it's a different situation where it's something that needs to be witnessed, it would be with the pharmacy or with whichever clinic has that set up for them. But the OPS in our community has no substances there. People bring their own substances to the space.
Okay.
Yeah.
That's a good clarification.
And I would clarify, because working with different municipalities where there are overdose prevention services, to some of our, say, harm reduction staff or other community service providers, their teams are talking about safe supplies and are giving out naloxone kits or a clean kit for use. Whereas safe supply for many is, free drugs or this and that. So there's a perception that you can go to an OPS for safe supplies, but those are actually harm reduction supplies. So language really matters. Yeah. And continued dialogue and conversation really matters, because it can really impact public perception, just even those 2 types of terms being misunderstood.
And that is the perception. People think that the OPS does provide drugs. I have a question just about, in terms of having all of these clinics concentrated in one part of town, because when I was visiting with AVI, they were saying that they have people from North Nanaimo and Central Nanaimo who have jobs, who come to get their methadone or Suboxone. Is there any way that Island Health can encourage clinics to open in other parts of town that provide these kind of services? Is there a role that Island Health plays, or?
Well, with private clinics, not as much, and certainly that's how some operate in our community. We always try to look and have been advocating for dispersed services, because it would be better. It would be better if we had, multiple OPSs up and down. The way Nanaimo is long, it does create challenges for people. So it is actually a conversation that we continuously have about where is there opportunity to have different services, because we do have outreach teams that go, way north. And then there's lots of services concentrated in the south end. So yes, we continue to always have those conversations. This opportunity is available to us with this location at this time, but the goal would be to try to disperse services and housing and concentration. I think everybody's probably of that same perspective.
Okay. I attended a webinar with Guy Felicella, which was amazing. There's one coming up, and I would encourage other councillors to attend, and I'll send the link. But he was talking about Road to Recover, and it sounds like an amazing program that we need to be continuing to move forward as a society. But he was also talking about one of the crystal meth. So we talk a lot about opioids, but crystal meth is actually very prominent in British Columbia and very prominent, I think, in Nanaimo. and creates, this is where we are seeing people with psychotic episodes, is that correct? Like especially people with mental health that are then using crystal meth. Are you seeing a lot of that at the OPS site as well?
I can just speak to that just from experience and working in acute mental health. Yes, in certain people, high methamphetamine use can trigger some psychosis. Sometimes it rapidly subsides once the substance effects are gone. Sometimes it might linger. Sometimes it might be residual and continue for a long time, and they might require ongoing mental health care and treatment. So it's different for each individual. Certainly working with, in collaboration with services like CAR 5-4, if somebody is experiencing, say, a psychotic episode and requires some additional support and maybe hospitalization or something like that, the teams would work really closely with community service providers and others in the community to make sure that happens. The acute kind of, I've just used my methamphetamines and now I'm fairly agitated and or experiencing some psychosis. If it's in a person who, once their substance effect has gone away and their paranoia, their psychosis, all of that kind of dissipates, it's a bit different. It's a bit more challenging. And so those are just conversations that you have with people as the care teams and care providers about reducing harms associated with their substance use. So this is what's happening. How can we help you with that so that this doesn't become a residual and long-term ongoing challenge?
Okay.
Yeah.
Thanks.
I could add just a little bit about just your question. Is it increasing? And you're right. We don't talk about it as much. And yes, I highly encourage watching Guy's podcasts. I don't like to speak next to Guy because it's very hard to follow him. He's a very compelling speaker. But the one thing I just wanted to add is that you're right. We don't talk about it as much as with opioids and alcohol. I did put out a report as Chief Medical Health Officer's report a year ago, and just for context added the crystal meth data because we don't speak about it as much. And there has been a steady increase in crystal meth associated or stimulant associated hospitalizations over this period. So that's probably again, these are illegal drugs, so it's hard to, I don't have consumption data the way I have consumption data on alcohol. But the hospitalizations related to crystal meth, which is one indicator, has been steadily on the rise.
Okay. Yeah, and I think it's one of the things when people see that reaction that people are having on the street, that's a major concern for residents. Just one last question about the change of rate in Nanaimo and the spike that we have here. Is it related to our homeless situation and the lack of shelter? We have one of the lowest shelter rates per capita for people that are homeless. I think we're at 15% of the population that's homeless have any access to shelter at all. Is that related to the spike that we see in deaths and in overdoses?
Are you, just to clarify, are you referring to the figure where we saw the divergence in Nanaimo
Yes.
and Island Health? Yeah, I think it's multifactorial. Like, I think there are multiple influences on that. I think you mentioned some of them. I think that we saw that happen during the pandemic as well. And so I think we saw a change in the risk for the individual who uses substances. So for example, when people were isolating, they were more likely to be using alone and at home, for example. That might have been one of the reasons. We saw a changing toxic drug supply as well. So these were all compounding factors that happened, post-pandemic, and it may have been possible that they compounded here, specifically in Nanaimo, a bit more than in other areas of the island that, like you said, might have more shelters or more services and more availability of things like in Victoria, where we did not see that divergence as we saw here.
Do we know what was happening in 2019? What we were doing right? Why we saw the downturn? And you just explained why the uptick again with COVID. But do we know what was working in 2018, 2019?
Right. I mean, and Rika, please correct me, but the harm reduction interventions were working.
Okay.
Naloxone was widely distributed by then. you know, communities were understanding the need, the issue, the challenge. There were emerging options available for people who were using opioids. And like Rika had said, many things changed in 2020.
Okay, thanks. Councillor Eastmere.
Thank you. I have a question about when you say that staff have relationships with the community and you know, do their best to work around the site to minimize impact. Are staff working in the Island Health location allowed to leave the immediate property to interact with people on the street? For example, like in, say, the parking lot of City Hall, are there any like work safe rules, like barring them from leaving the site to interact with people immediately outside of it?
If you're talking about like the primary care outreach team who is specifically there, or if there's teams or service clinicians that are coming into the OPS to meet with people, they absolutely can access the area surrounding. Yes, they do have safe work protocols, and you know, we, especially during the pandemic when outreach was, you know, there were some volatile situations. They certainly have ways that they work together to promote safety, and we have that expectation as well. If they are with a van or have a service set up, no, they can't all leave and leave one staff member alone. So there's those kinds of protocols that are in place, but generally speaking, the city, they can engage in any location, provided they've done a point of care risk assessment and it's safe to do so. So if there's a crowd of 30 people, we wouldn't ask 2 staff to go right into the middle of it. So they assess based on number, you know, kind of behavior of the crowd and easy exits, resources around them. So, but nothing prohibits them from going into a public area to see people.
Okay, thank you. Yeah, and I think because what we're seeing around City Hall is that a lot of that work is falling to the CSOs, and that is, they do amazing work, but they're funded by the city, and it is a big expenditure that the city has put into being able to provide these frontline services, and a lot of it is going towards serving people immediately outside of the supervised consumption site.
Yeah. And there's lots of discussion about the correlation about an overdose prevention service and crowds and congregation, and whether or not those people are actually utilizing that service. I don't know this, you know, intimate details of who is where and when, but our staff are also not enforcement. So they certainly can come and engage and speak with people, encourage people to seek out healthy spaces, all those kinds of things, offer service and do that. They can't actually make people or get people to move from areas. So congregation isn't super helpful in a lot of ways when there's a large number of people, different things and issues kind of emerge. So they do their best in those situations, but physically asking or getting people to move from that parking lot is challenging unless it's done in collaboration with others who might have a different approach.
Mm-hmm. Yeah, and I would just speak to the work of our CSOs. I know that they do a lot of, you know, just personal interaction, and it's not just enforcement. They are really just checking on people, making sure that they may have somewhere else to go if they don't know where services are, if those services exist. So yeah, I appreciate their work and also that of your staff. With the new services, will people be able to access alternatives to the unregulated toxic drug supply from the 250 Albert Street location, or would they more be receiving like a prescription that they would fill elsewhere?
Initially, it will be prescriptions that they're filling elsewhere.
Okay. And can you speak to the impact of the changes by the province to end the take-home, I know we don't like the term, but safe supply program? You know, despite the fact that the former Solicitor General and the RCMP's commanding officer said that there was no evidence of widespread diversion of take-home safe regulated supply, BC ended that program, and I just wondered, have we witnessed changes as a result of that?
So actually, if unless you have personal experience, I would really like to take that away and speak to our addiction medicine colleagues, because they're the physicians and clinicians who are managing these patients. And so they have an understanding of the details. I know there was a lot of concern about the additional barrier, especially for people who are stable on their medications, but what the actual impact was, I'd like to take away and bring that back.
Okay. All right, well, I don't see any further questions. I would say I do see the PCO team outside of City Hall quite often, working with people, and really appreciate their work. I know it's not easy work, it's difficult work, and I really appreciate the work that you're doing, the compassion that you provide to people that are in serious trouble in our community. And noting that we were supposed to be taking a break some 10 minutes ago, I'm going to just call for a recess now, and just thank you very much for your time and for coming out today to have this discussion with us. Thank you. And we'll reconvene in 10 minutes.
Given the access challenges, mature vegetation, and proximity of existing structures, the impact of the traditional method
You and
of digging
bylaw
up the
update
entire sewer was
recommendations. And this is going to be introduced by Bill Sims, our General Manager of Engineering and Public Works. Take it away, Mr. Sims.
Thank you, Chair. Good morning to the committee. And I'm going to just pass this right over, this exciting topic of parking that is not controversial at all, pass over to Fraser Ma, the city's transportation engineer. Thank you.
Thank you. Yeah, good morning. So I'll just do a quick introduction, and then we'll pass it on to Dan Casey, our consultant. So today we're here with a report that we've been here a few times with this topic, most recently in July, looking at how we can align our parking bylaws and policies with the official community plan, integrated action plan, and as parts of this project, various community engagements, surveys, developer consultations, and the feedback we've received at our previous touch points with the committee. So I just wanted to speak to kind of how we've framed the decision. We have the report, which outlines a number of recommendations that would update our bylaws and policies to get us in line with some of those objectives and directions that we want to go. And there's 3 of them that Urban Systems has identified as part of that staff have acknowledged might be a bit, progressive, pushing the envelope. So we are looking for direction on 3 specific items that have been recommended. Yeah, we'll speak more in the presentation, but those being introducing a maximum parking rate in urban centers, introducing a new category of transit-adjacent lands with specific rates that would be along bus frequent transit and bus rapid transit, and then introducing baseline TDM measures in certain contexts. So yeah, so just wanted to frame that we are looking for specific go, no-goes with respect to those. And then following this discussion, depending on direction, we'd be looking to start developing the actual bylaws and be bringing those forward. And there would be some follow-up. We've been distributing this with the aforementioned development community that we did the engagement with, neighborhood associations, and some other stakeholder groups. So that's my preamble. So I'll pass it on to Dan Casey with Urban Systems to get the presentation.
Thank you very much. Mr. Casey, welcome, and please go ahead.
Am I live here?
Yes.
There you go. Thank you. Thank you, Fraser, for the introduction. Much appreciated. And thank you, GPC members. I'm very happy to be here today to present out on, I guess, what's phase 3 of our work on the city's parking review and bylaw update. This, what we're going to speak to today, is a continuation of the process we've been working through over the last year or so. What we're up to is really focused in on the city's approach to regulations with respect to parking and mobility more broadly. The key direction in all of this is to identify opportunities for regulatory alignment with your overarching city policies specific to transportation and parking, most notably those found in City Plan. There's also an element of this related to updating regulation to align with more recent changes in provincial legislation, as well as we're looking to go a bit broader where applicable and where it makes sense as part of this to understand broader benefits beyond specifically parking advancements. So there's elements of that woven into this work as well. We've been undertaking an approximately four-phase process where I mentioned sort of in phase 3, which has us at the point where we've gone through a sort of a background review and analysis. We've engaged with the community and stakeholders and developed options. We're here in front of you today with what we've recommended to be some of the key directions for this work. So this will be recap from previous GPC presentation in July, but I think it's important. The work we're doing here is being carried out, and you'll see these themes reflected in virtually all of the recommendations that have come forward. This work is being undertaken through sort of these, under these 3 guiding principles. So the first is what we're up to here is largely aligning regulation with policy. So City Plan is an excellent OCP. Provides a lot of very good and specific direction where the city sees itself going with respect to parking. We're acting and executing on that by bringing forward proposed regulatory changes. Item 2 is around complete mobility, and so where maybe historically or conventionally vehicles have been the primary way of moving around, we're looking to sort of step back from that stance and revisit this complete mobility term through the lens of, in certain parts of the community, well, yeah, driving is probably still going to continue to be the predominant way we get around, and we craft parking regulation to reflect that. But there's also, again, guided by city plans, strategic areas of the city where added density, mixed use, and access to sort of multimodal travel options is envisioned to become more the norm, and we want to align parking regulations with that objective. So all within the lens of sort of this achieving complete mobility. And then lastly, much of the work here relates to off-street parking regulations and potential changes that might come there. Those regulations are used to guide land use and development decision-making for sites and buildings that could have quite a long lifespan. So we do want to make sure that the work we're doing here is putting into place regulation that'll guide building and development that might go down the path that the city sees itself going per the vision that's laid out in city plan. So this is aspirational and forward-looking. So I'm going to, in your agenda package, you have the complete recommendations and actions report that was Urban Systems, the city's consultant on this project. This was our complete recommendations to the city. We're going to touch just at a high level on some of the key pieces in there, but then spend a few minutes more specifically on the 3 items that Fraser had mentioned earlier that we wanted to bring here for sort of discussion and direction. So in a sort of a high-level sense, the recommendations have been broken out into a number of thematic or topic areas. The first was around recommendations with respect to vehicle parking supply requirements and vehicle parking supply rates. Some of the key items that are found in that section, the recommendation to remove minimum parking requirements in urban centers. This would be sort of a consolidation of some of the directions that have been passed down from the province with respect to TOAs, as well as recent change made by the city for the primary urban center and downtown. A couple other key items that we will spend some time on through this conversation. One, establishing a parking maximum in urban centers, and the other, allowing for a reduction in parking where proximate to higher order transit service. We've brought forward recommendations around transportation demand management, one being the potential to require TDM for sites that come forward that are contained within urban centers. Right now, TDM is typically leveraged as an incentive. So where relaxed parking is being sought, TDM is a way to sort of help support and justify that request. There's a suggestion coming forward that that might be compulsory in your urban centers. And then number 2 there is sort of to continue this process of making TDM an option to applications coming forward outside of urban centers. Specific to bike parking, recommendations around updating bicycle parking supply rates, including increasing supply rates in urban centers where cycling trip distances and availability of cycling infrastructure is anticipated to be higher. Improvements to bicycle parking design requirements, and then lastly, the introduction of cycling end-of-trip facilities as a requirement for select uses. So these would be things like showers, lockers, change facilities that would help accommodate most specifically commuting cyclists and make that a more attractive travel option. Recommendations around accessible parking, improved and updated design requirements, including ensuring that a portion of accessible parking spaces can accommodate vans, larger vehicles, as well as introducing mobility scooter parking requirements for select use. A couple others to touch on. We've made the recommendation that the city's current cash in lieu of parking policy is removed, with some of the items that I've described here that potentially coming forward, as well as sort of the level of uptake on it right now. We're recommending it's no longer needed. And another smaller one, but important, is a two-tiered loading stall requirement, so that we have dedicated stalls, purpose-built stalls for some of the more conventional sized vehicle delivery services that we're seeing on the streets now. E-commerce delivery, meal delivery, that sort of thing. And then not specific to off-street parking regulations, but sort of adjacent and related bylaws, we've made recommendations around the need to establish a more formalized curbside management framework. So the idea being a tool, a resource that can be used as reference when entertaining options and making decisions around how to allocate curb space. Right now it's largely absent, and so a tool that could be referenced in those cases. We've made a number of detailed recommendations on updates to the traffic and highways regulation bylaw, crossing control bylaw, and subdivision control bylaw. And then lastly, made the recommendation that a curbside inventory and then ongoing monitoring to understand conditions and use of those curb spaces would be a valuable resource to the city now and in future when entertaining changes. Okay, so we introduced off the top, there's a whole suite, a whole family of recommendations that have come forward. They're detailed in the document that's in your agenda, open to sort of input and feedback on all of it. But I think what we did want to bring very specifically to this meeting were 3 items where we're seeking input and direction through the lens of we've made recommendations to the city on a good way to go about regulating off-street parking, but there's some questions around whether now is the right time for a couple of these items, or whether we'd be smarter to be revisiting these in a few years' time. And so those are the items we've brought forward here, and I'll speak to 3 of them. So the first is the recommendation around introducing parking supply maximums in urban centers. This, there could be conversation on exactly at what number, at what figure that maximum kicks in, but we've recommended at 150% or 50% higher than what the baseline rate would be. The idea with the maximum is to protect against oversupply in urban centers, which are identified in city plan as sort of your most critical and strategic locations for redevelopment and added density in future, sort of this idea of creating little complete communities, and the potential that parking oversupply in these areas could really deter from the kinds of development, the kind of communities you're trying to create in these areas. So we've brought this one forward with that rationale in mind, but also understanding that instilling a maximum in regulation will also prevent certain land uses, certain development types, and certain applications from coming forward. There'll always be a variance process they could seek, but this would be introducing a barrier to certain development forms in these areas. So we did want to bring this one to the group's attention and seek some feedback and direction on that. Item 2 was the recommendation around reducing minimum parking requirements where within 200 meters of a defined bus rapid transit or bus frequent transit corridor. The rationale for this recommendation is to support added density or new development to come online where it's within close proximity to transit, and also have a greater proportion of future residents within the city residing within close proximity to transit. Alongside this would be a requirement for transit supportive TDM alongside these new developments. So the idea that a reduced parking provision alongside contributions towards seeing more people utilize transit. The maybe point of pause on this item is that the BRT and in particular the BFT are city plan, they're planning designations, and they're not necessarily seeing the level of transit service today that city plan and all of us envision seeing on those corridors in future. So there's more than likely a conversation to be had around whether we're ready to entertain developments in these areas with reduced parking when the transit service that we envision on these corridors isn't necessarily in place today. And there's just a map on the screen here illustrating approximately what a 200-meter offset looks like from your BRT and BFT corridors, just to help paint a picture of how many sites might be subject to this regulation. And then the third item relates to transportation demand management. So I mentioned earlier, right now, TDM is pursued most commonly as if an application comes forward seeking reduced parking supply. Most commonly, TDM is one of the ways to help offset that sort of reduced parking provision. What we're proposing for urban centers and transit adjacent lands is their TDM would be required. So it's not a, if you do this, you get this, it's a requirement. There's a reduction in the baseline parking supply rate in the urban centers. Is actually what's being brought forward as an elimination of, but part and parcel to that is the expectation or the requirement that TDM will be provided. I think again, the point of pause and why we've brought this to GPC's attention is that with a couple of the likely avenues to require TDM, transit passes, added cycling facilities and amenities, and contribution toward car share, those services aren't necessarily fully in place or matured yet in this community. And so a pause point around, is this the right time to bring regulation in around, say, like car share provision, for example, when we know that in future we'll see more sort of reliable and robust service in place. So with that, I'll close. I think what we're hoping from GPC members today is direction on the recommendations as a whole, as well as specific input and direction on the three that we brought to your attention. Next steps would include taking the outcomes from this meeting, making updates to the relevant regulatory documents, which would come back to council at a future date for formal reading and adoption. Thank you very much.
Well, thank you, Mr. Casey. I don't see any questions yet, but I have one right off the top. And that's related to why we would have parking maximums. My understanding is that a parking spot is worth about $50,000 to a developer. I know that some of the malls, you know, Woodgrove or North Town Center, they're built out to create parking for the busiest shopping days of the year, Black Friday, Boxing Day, the first, you know, the last few days before Christmas, and so those parking lots are rarely ever full. Why would a developer build out beyond 150% of the maximum requirement?
Yeah, it's a really good point, and that's kind of at the crux of what we're trying to do here. City plan does envision, so you've picked up on a lot of the urban centers are currently retail malls, shopping centers. City plan envisions those looking a little different in future, a bit more mixed use, complete community, higher density. And so what we're trying to do here through parking regulation is limit that supply of parking so it's at a level more appropriate to where city plan sees those areas, communities being in future. It's a kind of a slowly working away from the idea that the urban centers are large format, sort of commercial use focused, and into something that's of a higher density and more mixed use. So But the exact point you've raised is why we've brought this item to the attention, is that it's a big shift, it's a philosophical shift, and it's maybe a question of, is parking regulation the right way to be achieving this, or maybe it's one of the ways to be achieving this, but is it the right one or the only one?
Yeah, I just think if I was a developer, I would want to be creating that space for other things and maximizing my ability to make money off the land that I own. And I understand, eliminating parking minimums allows for developers to make those decisions based on, who they think they're developing for and whether they're going to need parking spots or not. But I guess if you're thinking about Woodgrove or North Town Center, there's big parking lots there that could eventually have residential attached to it. And is that the idea behind having a maximum like that then, or?
Yeah, it largely is. It's to protect against sort of continuing down the path that how development has occurred on those sites sort of to date, and would protect against more of that. It would allow for a maximum does not get in the way of adding density, and therefore sort of your parking supply with more land use and the same parking supply. This is enabling density and not doing anything to deter it.
Okay, well, I see I've encouraged some other questions. Councillor Eastmere.
Thank you. So for developers who benefit from the reduced parking requirement, do you think that developers then pass on those savings to renters, or are there what are the benefits more broadly than just making it less expensive for the developer?
Yeah, that's a really good question or comment, and it's sort of a theme I think that has come up throughout this process. I would maybe add to it, it's both. So the parking minimum is either reduced or eliminated, which is a few of the scenarios we're talking about here. The question is sort of like, then that's cost savings to the applicant. Is that passed on in the form of lower housing costs? We don't know firmly. We've done our best to sort of look at the research and figure out in other communities how this has looked. We don't know for certain. I think the one thing that we have heard in conversations on this process was that it's common, it's not always the case, but commonly the parking supply that's ultimately realized with a project isn't always dictated by what's in the regulation. The regulation sets a minimum, or what we're entertaining in centers here is no minimum at all, but that it's more of a market-driven determination of how much parking is ultimately supplied. So where, going from a minimum right now to no minimum in urban centers does sound drastic. It doesn't necessarily mean we're going to see zero parked projects. There's still the feeling that the market and what applicants feel will sell is what will come forward. So back to the question of sort of, will the elimination of minimums lead to lower housing costs? We don't know for certain. Chances are it will. We don't know for certain. It won't go in the opposite direction. We're removing a barrier here and making development that much more sort of appealing in these areas.
Thank you. And I think one thing that I often hear from the community is, especially around people with accessibility challenges and disabilities who rely on private vehicles, that they feel that they end up in buildings where they don't have access to parking. And so I want to make sure that changes that we make don't reduce the number of accessible spaces, and maybe put a greater focus on ensuring that of the limited parking spaces that may be offered, that that some of them are reserved for people with accessibility challenges.
Yeah, great point. Short answer is yes. The elimination of minimums would still come with accessible parking requirements and loading requirements. So these.
Do you mind just moving the microphone maybe closer to you, or just speaking up a tiny bit, because it's a little bit hard to hear you?
Happy to. The short answer is yes. the elimination of minimums won't impact accessible parking requirements or loading requirements. Those would still be in place.
Thank you.
Councillor Brown.
Thank you, Chair. It took a while. First, I just want to say thanks for this, and I also appreciate kind of like teasing out the ones that you think might warrant a little more debate or direction from council. So if it's okay, Chair, to help focus it, I would like to actually just make a motion to endorse all recommendations contained in the parking review and bylaw recommendations and acting report prepared by Urban Systems dated October 2025, except recommendations VPS 2, VPS 3, and TDM 1. And if there's a seconder, I can quickly speak to that.
Is there a seconder for that?
Thanks, Chair. I
Did
do
we
think
get a
we should.
seconder? Sorry.
Oh, sorry.
Did we get a seconder for it? Okay. Councillor Eastmere seconds.
Thank you, Chair. I do think we need to absolutely provide direction, but I think if on the other items, but I think in my opinion, everything else could probably be endorsed and passed on. That way we could focus conversation and the meeting time on those three items. Thanks.
Okay. Councillor Gesselbrock, you're up next. Do you want to?
Does that include VPS 3? The motion that you're moving?
So the motion is essentially in the staff report.
Yeah.
It excludes VPS 2, VPS 3, and TDM 1.
Okay.
Councillor Gesselbrock?
Just give me a moment here. If there's other speakers ahead of me, take them.
Mayor Krog.
Thank you very much, Chair. All of us got a short email this morning from a citizen said, please do consider that many people with disabilities and seniors rely on cars which need space to park near building entrances. And that's certainly a consideration, but my question was more of a general nature. Doug Todd, who writes in the Vancouver Sun, you may have seen it several weeks ago, had a couple of columns, as I recall, on this issue, and that some cities are moving away from, how shall I say, reducing the number of parking spaces and in fact recognizing that it can create problems as well. And I just wonder if you have any comment about where the trend is going. In other words, what we're proposing here, is that still the dominant trend, which it appears to be, or are we seeing that kind of pushback that Mr. Todd was writing about?
Yeah, it's a good question, good point. I think it's worth sort of considering parking supply almost separate from parking regulation. I would say the trend on parking regulation over the past few years has been, which aligns with generally what we're bringing forward here, is to dial back the level of regulation, including dial back the level of minimums that are in place, through the lens of both achieving lower parked projects that are supportive of people riding the bus and engaging with AT, but also introducing a level of flexibility for the development community to allow the lack of a minimum parking requirement does not necessarily mean a zero parked project. It's introducing greater flexibility so that applications can come forward that meet the market's needs and aren't sort of have this bottom end minimum in place that acts as a barrier.
Okay.
Councillor Gesselbrock.
Thanks. Yeah, my question is just, you know, I think the goal is here is to reduce sort of unnecessary regulation on what the developer will build around parking, and like the market will still determine, you know, what the use is, and probably a lot more sensitive to what the needs are. And so my question is just in terms of, it's like VPS 3 or VPS 2 is just like, why not have it expanded to cover the BRT areas and the BFT, like the rapid transit and the frequent transit areas as well? I'm just curious, like the timidity to just include that in there, because I don't think it accomplishes much to have the minimums on those locations as well, and it just puts us back in the same place as now, that we'll just have to figure out a new set of minimums in those areas as well, Whereas like if the issue is accessible parking spaces, great, have a regulation on that, just like there's this X amount of, you know, what feasible. So that's my question, and why I've got hesitancy supporting this is that like, you know, maybe the debate can maybe happen for VPS2 to just expand it for BRT and BFT. But that my question first off is that why the hesitancy to just have it the minimum eliminated for the BFT and BRT areas? My brain's swimming.
I can speak to that since, yeah, it was staff that kind of flagged those ones. So as Mr. Casey mentioned, one of the big components is that, you know, with reducing parking requirements and supply rates potentially, since there are minimums often, the goal is that is replaced with other ways for people to get around, and whether that's land use planning so that people have better access to their needs within walking distance, better, you know, bike infrastructure, that sort of thing, and then also transit. I think one of the big things that we've been discussing is that rate of transit expansion and improvement, and yeah, just how that's kind of coming online. So I think I think one example is that even within how we're defining bus frequent transit and bus rapid transit, it's not perfectly aligned with sort of other jurisdictions, because they have, like in Lower Mainland, they have much better service just because of population density and other reasons. So where we're not necessarily seeing that transit service coming online to help take that burden of trips that would otherwise be used with vehicles, that's kind of the sensitivity there, is that we're just not certain that it perfectly lines up.
Great, yeah, you know, I think, you know, development like this, when it comes on, it'll be 5 years before it happens, and, you know, there's, at the RDN, there's like quite a lot of expansion that's in the works, and I guess like, just like, why, we don't need to worry about that. Like, you know, we can let the developers worry about it, and I think, you know, it is moving in that direction, and we just don't have to involve ourselves in that aspect. And so I think that would be my take on it. And the way that this is set up, I don't know if just for VPS2 we can make an amendment to expand it to those areas and debate that, or if it's easier to, yeah, maybe that's probably the best way to do it, as opposed to change VPS3 instead of saying allow to reduce vehicle parking supply for multifamily resident near bus rapid thing, to just say to eliminate it. So yeah, I think I'll probably just wait for debate on VPS2. Thank you.
Chair, if I might. Just really briefly, one of the things I think that is being reflected in the comments of Fraser and Dan is that it's about timeliness, right? It's not that this can't be brought forward in the future when we see sort of a greater transit service on those routes, in accordance with, you know, all of the studies and all of the work that both the RDN and the city are doing towards those corridors. It's just that this might be a little bit premature to start that process. Yeah.
Great. No, I appreciate the sensitivity to that, and thanks.
Oh, thank you. I see no other questions, so we have a motion on the floor. All those in favor? Any opposed? Seeing none opposed, the motion passes. Do we want to have a discussion then on VPS2, VPS3, and TDM1? Any further discussion? See nobody at the mic.
Oh.
Okay, Councillor Gesselbrock.
Yeah, I mean, I'll put forward an amendment that VPS2 first. I'll move that we support the recommendation of VPS. I'm just trying to figure out how to do this. Or we just go through each of these recommendations and move them. So first I'll move VPS1.
Okay, do I have a seconder?
Sorry, excuse me, Chair. Just VPS2 is the first.
VPS2 is
VPS1 you've already incorporated into So on page 36 of
So we've
the-
moved VPS 1 and VPS 3?
No, we have VPS 2, VPS 3, and TDM 1. Okay. So Councillor Brown.
Thanks, Chair. I would move that VPS 2 to introduce a maximum number of parking spaces permitted for developments in the primary and secondary urban centers be incorporated.
Okay, seconded Councillor Perino. And discussion? Do you want to add to that?
Sorry, I think I needed to add maximum equal to 150%, but
Okay. It's a recommendation, so.
yeah, okay.
Yeah.
Yeah. Okay, perfect. That's the one, yeah.
Did you want to add to
Yes,
that?
I just want to say that I think 150% is pretty generous. You know, there's, I think, a lot of talk about the cost of parking, of a parking space, and as it relates to development. I think it's a little bit more complex scenario because surface parking is quite cheap, but if you start to go to higher densities, you either have to do podium or underground parking, and so no development, I think, that's going to be up against parking requirements is going to have a problem with that number. It's always going to be the opposite, because once you start to get into higher density, even the podium style, it's not just the parking space. So if you incorporate, you know, if you're having to spend your first story, you know, if you're having to spend your first story on parking, you're losing floor area ratio and you're losing building height and all sorts of things. So I think that's a very generous number, and happy to support that.
Okay. Councillor Hammonds.
Thank you, Chair. I will support, but I will note I had some reservations on this one simply because when we reduced the parking minimums, when we removed the parking minimums, we used the rationale that the market can decide. And so we're putting another regulation on top of that rationale that the market can decide. But having said that, I also I agree with Councillor Brown's points. I also want to acknowledge the points of Mr. Sims in terms of timing all of this. I think this one is probably okay to go now. So I'll support. Thank you.
Okay. Councillor Eastmere.
Thank you. I just wanted to ask about the impact of this potentially pushing more cars onto like city streets and people looking for parking around developments. Like, how do we mitigate that potential impact?
I can get us started. I think that's a very good point. The comments earlier from Councillor Brown that the maximum being proposed at 50% in excess of was purposefully done to not be too restrictive and to be a good place to start. I could absolutely see a version of this in you know, a certain number of years down the road where we're back here going, that 50% was quite, you know, quite lenient, quite conservative. Now is the time to bring that down a little bit more, which to the point here, I don't know that there will be a very large impact in the shorter term in terms of creating a spillover effect. I think also what's been brought forward in the recommendations related to curbside management and on-street parking will provide the city with sort of the framework and some of the tools needed to more proactively understand the curb space and then management of it as some of these higher density and lower parked projects might start coming forward. So, and that was done intentionally.
Thank you. I think one other like comment I often hear from people is like with the housing and rental costs being what they are, you often have people sharing housing. So when you might have expected a 2-bedroom apartment to be occupied by a family that has one car, you end up with 2 roommates who both work jobs and both need vehicles. So like, I just feel like we're still in this crunch where housing remains unaffordable, and as a result, like people are co-living and having private vehicles to continue to get to work, and it's just, we're still in this like awkward middle stage where it's unaffordable, and that results in people needing vehicles to get to jobs and share housing, and as a result needing potentially more than one parking space per unit.
I have a question for staff. What is the minimum requirement now? It's like 1.25 or something like that for an apartment, a one-bedroom apartment or two-bedroom apartment?
Certainly look to my colleagues in planning, but I you know, it varies by zone, right? It's like 1.2 for a certain zone or 0.8 for another zone.
Okay.
Yeah. To the rescue comes Mr. Hall.
Okay. Yeah, because so it's different for different parts of town and different types of builds.
Yeah, thank you, Chair. So yeah, as Mr. Sims had mentioned, it does vary throughout the city, varies by area, and also it's based on number of bedrooms. So it's really, there's not a straight up single rate that we could tell you clearly applies across the city. The update to the parking bylaw in 2018 kind of developed some sensitivity around our parking rates around walkability scores, and tried to look at that level of detail at that time. So we don't have a fixed rate across the city.
Okay, thank you. Any further questions or comments? Seeing none, I'll call the question. All those in favor? And any opposed? Seeing none opposed. Thank you very much. Now we can move on to the next one. Is that VSP 2? No, VSP 3. Somebody want to speak to that? Okay, Councillor Eastmere. Oh, you're going to move the motion?
I can read it out. So VPS 3, that's a 25% reduction in required parking within 200 meters of frequent or rapid transit corridors with additional transit TDM required, proposed for multi-family residential uses only, and support, as a result, more people living close to transit and encourage transit use.
Thank you. So moved by Councillor Eastmere, second by Councillor Hemmons. And discussion, did you want to add to that, Councillor Eastmere?
No, thank you.
Okay, Councillor Gesselbrock.
Thanks. Just first a few questions. Just in terms of it only reduced parking minimums for multifamily residential developments, how come not all uses?
Yeah, that had been brought forward with the sort of feeling and understanding that people's place of residence is more easy to target and build comfort, that we can influence how their travel mode of choice based on their place of residence, in this case within 200 meters of transit service, versus those that might be, say, commuting into an employment use that's within 200 meters of transit, doesn't necessarily have access to those same transit levels at their place of residence, which might not be in the BRT, BFTs. So that was done intentionally. Yeah.
Right. Yeah, I guess like I remember the case of pub asking us to remove parking minimums on a corridor, and yeah, we probably don't want people driving back and forth from pubs, and probably an area that we really promote sort of transit and active transportation to and from. So it kind of like eliminates things like that. And I guess like, you know, if I was a business trying to do my market analysis of who would be using my services, I would decide what parking would be suitable or not based on that, and kind of allow that decision making to happen. And so I kind of feel that it's overly restrictive. You know, for the other ones, we're saying it to be for residential and all uses, to have that the same. So, and then also to my question, just for just reduction and not just the full elimination for the BRT and bus frequent transit area. And, you know, I hear the concerns of, you know, whether there's enough transit currently, but I do think that with just keeping it a full minimum, you know, the developer and the banks can decide how many parking spots they think suitable, and it's a chicken and the egg type thing. Like the transit will eventually come, and maybe BC Transit sitting there is like, oh, we got to make sure there's enough developments there to justify that. And so I would move an amendment for VS3 that to just eliminate parking supply for multifamily or for all uses near BRT and bus frequent transit service.
There was a seconder for the amendment?
Clarification is just instead of being reduce vehicle parking supply, to just eliminate parking minimums for multifamily residential or for all uses near BRT and BFT service areas.
Is there a seconder?
I'll second for discussion.
Okay, seconded Councillor Eastmere for discussion. And you.
Great, yeah, I feel I made my points. Basically, the market can decide how much parking they want to put at the multifamily residential or for commercial enterprise in these areas. I don't think that we need to regulate that if we're not doing it for the urban center as well. And that, yeah, I don't think it is a consideration of how we feel at this present moment, whether there's enough transit there or not, because ultimately, yeah, it takes 5 years for development to happen anyhow, and these things are changing rapidly, and so why get the city in the way? Thank you. I think just reduce the regulation and get the city out of the way. Thank you.
Councillor Eastmere.
Can you go to Councillor Perino first?
Oh, Councillor Perino. There we go.
Thank you, Chair. The problem that I have with the amendment is that it completely changes the motion. Not necessarily is it a bad motion, but we should in fact vote in favor or vote down the first motion. The amendment completely changed it. So it's no longer an amendment, it's a change, and so I'm uncomfortable with that. I would prefer that we go back, face the motion, decide or vote against it first, because the amendment is not, it changes it too much. It's not stable in itself.
Okay. Well, we have the ability to vote it down. Councillor Eastmere.
Thank you. When I talked to people about this one, I think what I heard back was something along the lines of, we have rapid transit. And so, like, I know that this is part of a longer term vision, and yes, we have transit, but I don't think people yet identify the transit that we have as being rapid transit, and that's just because of frequency and also just the geographic makeup of Nanaimo. And I think a struggle with this one in particular is when people think of multi-family residential, they think of families, and families nowadays often have 2 vehicles just to facilitate both parents having jobs, and so it's just, I think there's a disconnect between people's perception and experience of the current system and then the future of the city that we're trying to build for. And again, we're in this like murky middle zone where we're not quite there yet. But yeah, so this one I struggle with a little bit for those reasons.
Councillor Hemmons.
Thank you, Chair. Speaking against, this was one that I actually was potentially going to pump the brakes on anyways, partly because the RDN has been really vocal about getting more transit hours, and I think we've been successful, but we haven't seen the ceiling of the transit hours that we've asked for, and so for us to, I just think this is a bit premature without knowing when those transit hours are going to come online. So I feel that staff's recommendation or the consultant's recommendation is actually a kind of a middle ground. It's a measured approach that allows us to test it with multifamily residential projects while continuing to advocate to BC Transit through the RDN to get our transit hours increased. Thank you.
Okay, thank you. I would add too, I think that people, it may make sense to have this as a voluntary thing for multifamily units along rapid transit corridors, but people that are accessing services along those corridors may be coming from suburban neighborhoods, and they're going to be still utilizing their car and may not have the kind of transit access that they need to be able to go down and use those services. So I'm going to vote against the amendment as well. Councillor Eastmere.
Thank you. Something that you mentioned with the, you mentioned a voluntary way of abiding with this. Like, we already have incentives that if developers wanted to voluntarily reduce the amount of parking, they would receive incentives for that. Is that correct?
That's correct.
Okay. All right, so Councillor Gusselbrock.
Just to speak again, just with us not having minimums, we're imposing the regulation. It's all voluntary. The developer can do whatever they want in the regulatory environment of eliminating minimums. That's what I'm saying. We're intervening with our idea of what's needed and not needed. And I think that's the question is do we know, and do we actually have the ability to make that decision, as opposed to the developer knows exactly what the transit quantity and frequency is. They can decide for themselves, yeah, Nanaimo Regional District Transit Service is not quite there yet to justify having this amount of parking. I'm going to put this much parking. We can just get out of the way. And I think that's the point, is that we talk about over-regulating. This is an example where, we can peel it back a little bit. And that actually aligns more with the direction we're trying to move things anyhow. So something to think about. That's all I have to say. Thank you.
And I would just ask staff, businesses that have development permits can seek variances on the number of parking spots that they're required to have based on ability to, or connection to transit. So that we're talking about multifamily, but we're talking about adding all uses. And businesses could ask for a variance in the number of parking spots that they're required to have.
Yep, yeah, that's
Okay.
correct.
All right, on the amendment. So we're voting on the amendment. All those in favor? Councillor Gusselbrock, Councillor Eastmere, and those opposed? Mayor Krogh, Councillor Perino, Councillor Hemmons, and Councillor Manley. And so the motion's defeated. And now on the main motion, is there more discussion people want to have about the main motion on accepting VPS 3 recommendation? No more discussion? Okay. And that was moved and seconded already, I believe. So all those in favor? And none opposed? Motion passes. Moving on, TDM1. Does anybody want to make a motion for a recommendation for TDM1?
I'll move it.
Okay, moved by Councillor Gusselbrock, second by Councillor Eastmere. Discussion? Councillor Perino. Oh, actually, I got Councillor Eastmere. Did you want to speak to it? Or, okay. Councillor Eastmere, sorry.
What I like about this is that the idea is to encourage sustainable transportation and complete our mobility in, as it says, urban mixed-use areas. I think that what we're hearing a lot is that we want to be really considering how we can support active transportation, and that means walking, cycling, to make it so that people can actually connect and get to where they need to go and don't have bike lanes ending, and really completing that those mobility routes. And so I think that this helps us move in that direction, and we need to continue to talk about end-of-trip facilities, and that includes places to lock your bike safely and things like that. So thank you.
Okay, thank you. Councillor Perino.
Thank you, Chair. I just wanted a question of clarification that we are simply following staff's recommendations for this.
Yeah.
Is that correct? Thank you.
Councillor Hammonds.
Thank you. To Councillor Perino's point, I think we're following staff's recommendations in terms of policy, but it's the timing that's up to us. That's what we're being asked about. I've had my bike stolen from a city council meeting. So I really believe in end-of-trip facilities. I'm curious about this sentence: a menu-based approach allows flexibility. A cash-in-lieu option would also be introduced. Could I hear more about that? And whether if we do cash-in-lieu, would that, sorry, Paul, allow us to pool that funding and maybe have the city do a bigger end-of-trip facility, say in the downtown area or around transit hubs?
Go for it.
I can start us off. I think there's the intent there is twofold. One is conversations around car share and whether the system was at a level of maturity that those TDM contributions toward a vehicle and passes would be fully leveraged sort of in the shorter term. This was one way of saying, okay, if that's not the case, depending on where this application's location is, it can be pooled in a cash in lieu of that TDM contribution and used for other ways, so that it's still productive and sort of contributing to that reduction in parking demand that's commensurate with the lower rate. And then two is exactly as you're suggesting, where it's okay on a sort of a case-by-case basis, but if we might be better served by pooling those funds and contributing to something bigger, well, we've got these contributions will be a start toward that.
Thank you. And just confirmation from staff, if I may, that this cash in lieu option, it would always go to TDM? Like it couldn't be used for something else?
Yeah, that would be the intent, and we'd still have to write kind of the policy specifics around it. But yeah, it would be to replace what otherwise isn't able to be provided to achieve the objectives.
Okay, and I lied. I'm sorry. I have one more question. Do we have any figures on the cost comparison of providing a parking stall versus a TDM measure? Or to whomever?
Yeah, in general terms, we don't have any cost to provide parking infrastructure figures specific to the city of Nanaimo, but in general terms around the province, throughout Western Canada, I think some of the figures have been thrown around here is that surface stalls can vary from anywhere from 5,000 to 20, 25,000 per stall. Once you get into structured parking, you're generally $50,000 and up, depending on type of structure, value of land, sort of construction variables, that sort of thing, versus the dollar value of some of the TDM items that are coming forward here are, especially in comparison to what structured parking might cost, they're a fraction of that value. Yeah.
Thank you. So we're reducing the developer's requirement to put in expensive parking, but we're requiring them to put in 2 of 3 TDM measures or taking cash in lieu that would allow us to do that on a bigger scale. Accurate?
Correct.
Great.
And I'll just add, that's why we feel this item is important, because we've entertained, and I think we've successfully passed, elimination of minimum parking. So we've created a cost benefit, we'll say, to applicants coming forward, which is why this compulsory TDM item is brought forward, to make sure that's realized alongside the reduction in parking.
Thank you.
Okay. Councillor Gesselbrock.
Thank you. So this is TDM 1. TDM 2 is already passed. Okay. Yeah, I'm in full support of TDM 1. I think that it's a critical policy to have in place with the work that we've done eliminating minimums. And so I'm in full support. Thank you.
Okay. Any other speakers? Any other comments? Seeing none, all those in favor? Any opposed? Seeing none opposed, the motion passes. Is there with one more recommendation. Okay, Councillor Hammonds moves the final recommendation. Seconder, Councillor Perino. And this is direct staff to prepare necessary bylaw amendments and policy updates to implement all endorsed recommendations. Any comments, questions? Seeing none, all in favor? Any opposed? Seeing none opposed, the motion passes. We are now at 10 to 12.
Yes, thank you, Chair. So there is lunch scheduled at noon, which could go for 30 minutes or whatever the committee decides. We could start it now and come back at 20 after 12 or 12:30 to start the final presentation, if you wish. Probably 12:30 would be okay, just in case your lunch is to make sure lunch is here, etc. So if you want to have that recess, that would be good. I know the next consultant is available until 1:30, so starting at 12:30 should work.
Okay, well, I don't think there's any point in starting the next agenda item with 8 minutes left. So I will call a next item on the agenda is under Healthy Nanaimo, and it is Manufactured Home Community Relocation Assistance Policy, and this is going to be introduced by Jeremy Holm, the Director of Planning and Development. Take it away. Sir.
And just Chair, just before Mr. Holmes starts, I just wanted to remind you that Ms. Brinkman is here as well to do the staff presentation with Mr. Holmes' introduction, and that Justin Bearer, he is part of the end of their presentation, and then it'll be wrapped up, and then you'll hear a presentation from Mr. Brian Snyder, Chair of Manufactured Home Community Stakeholder Group, followed by the delegation. So just the order of proceedings has changed slightly, and I just wanted to remind you all of that.
Okay, thank you for that. Please take it away, Mr. Holm.
Great, thank you, Chair, and yeah, happy to be here in front of the committee presenting this project. Ms. Brinkman, you've heard Lisa Brinkman, Manager of Community Planning, will lead the presentation. She's led the project along with Warren Mann, Property Services Agent, who's been a key part of the project as well. So happy to have Warren's support, and Lisa and Warren will be speaking as well. We have, as Ms. Gurry mentioned, we have a land economist on the line that has been part of providing information to support this and is available to present and answer questions as well. This is actually phase one of what we're calling the tenant protection project. This phase is specific to manufactured home community protection, and we're calling this the Manufactured Home Community Relocation Assistance Project. This policy consideration in front of you today. And the second phase will be a rental tenant relocation assistance project, which is focused more on more standard rental tenancy within multifamily dwellings. This, given we split it apart, given some of the unique context around manufactured home communities and both the provincial framework around protection for manufactured home owners and some of the context specifically around the Nanaimo context with respect to the economics and the land use regulations around those parks and potential redevelopment of those parks. So hope that makes sense to you, and I'm happy to turn it over to Ms. Brinkman. Thank you.
Please, go ahead.
Thank you, and good afternoon. And I do, yeah, perfect. PowerPoint, thank you. So today, Mr. Mann and I are pleased to present the Manufactured Home Community Relocation Assistance Policy for consideration of endorsement. And the goal of this project is to propose assistance beyond provincial requirements for residents who are required to move when a property is considered for redevelopment. And so, as Mr. Holm mentioned, today the focus is on manufactured home communities, and the next stage will focus on tenants of older rental apartment buildings that may face displacement. And also, as part of this project, we've been working with a land economist to create a financial feasibility assessment to understand a developer's ability to offer compensation. And the reason this was important was because the goal of this project is not necessarily to deter development, but to support residents that may face displacement. Also, a manufactured home community stakeholder group was formed to represent the interests of residents of manufactured home parks and to help shape the proposed policy. And staff held 4 meetings with the stakeholder group. Next, staff invited all manufactured home park property owners to a meeting in September and gave them an opportunity to review the policy, and also the development community was invited to comment. The city has currently approximately 22 manufactured home communities containing approximately 1,700 homes, and Nanaimo is a growing urban center. Similar to other cities in BC, Nanaimo's manufactured home communities may soon face redevelopment pressures. And so manufactured home communities can be vulnerable to displacement and may have limited affordable options when their property or their home is proposed for redevelopment. And the purpose of the policy is to ensure an applicant takes all reasonable measures to mitigate impacts when residents are displaced due to redevelopment of property, and to provide guidance about the city's expectations at the time of a rezoning or subdivision application for a manufactured home community property. Now I'll turn it over to Mr. Mann.
So the proposed policy has 3 centers of focus: communications with the manufactured home community residents during the application and redevelopment process, financial compensation for residents, and other relocation assistance that may be needed to relocate residents. In developing the proposed policy, we learned from best practices used in other municipalities. We consulted with the manufactured home community stakeholder group, and we consulted with owners of manufactured home parks. We also had to weigh the findings from the financial feasibility analysis conducted by Urban Matters, as well as legal advice received from the city's solicitor. In summary, the proposed policy states that a rezoning or subdivision applicant must give written notice to residents of the proposed development and any relocation assistance that will be provided, host a meeting with the residents, have ongoing communication throughout the development process, provide evidence to the city of their communications with the residents. Regarding compensation, the rezoning or subdivision applicant must offer to purchase each owner's manufactured home for an amount that is equal to the assessed value or the appraised value, whichever is greater. If the homeowner does not accept the offer, the developer is to provide compensation for expenses related to relocating the manufactured home to another property. $10,000 for a single wide or $20,000 for a double wide. It's important to note that the Manufactured Home Park Tenancy Act also requires the applicant to provide $20,000 in addition to any city requirements. The policy also includes best practices taken from other communities that can be negotiated on a case-by-case basis, depending on the specific needs of residents. These include that there could be consideration for financial compensation to assist with transition impacts, such as moving expenses and rental costs, to a maximum of $5,000 per unit. There could be consideration for the presentation of housing options that are available in the greater community. And there could be consideration to provide a relocation coordinator that would be responsible for helping residents who need logistical assistance. This part of the policy is designed to be flexible and will depend on the applicant's ability to fund this additional relocation assistance, which is contingent on the land lift that the rezoning provides. So how does the proposed city policy go beyond provincial requirements? Sorry, there we go. The city's policy would alleviate the requirement for a manufactured home owner to prove through RTB dispute resolution or the BC Supreme Court that they cannot move their home or they have nowhere to move it to. This requirement can be onerous and stressful on a homeowner. The Manufactured Home Park Tenancy Act allows for compensation based on the assessed value, that's the tax assessed value of a home that cannot be moved. The city's policy would require the applicant to pay assessed or appraised value, whichever is greater. This provides a more fair compensation, which should be based on market value. The city's policy would require an applicant to pay $10,000 to $20,000 for moving a manufactured home. This is if the resident chooses not to sell. This would be in addition to the Manufactured Home Park Tenancy Act's $20,000 mandatory compensation. The city's policy would require ongoing communication throughout the development application process. The Manufactured Home Park Tenancy Act does not speak to communications except for the service of notices. The city's policy would allow for the potential negotiation of additional relocation assistance depending on the needs of each community, such as providing a longer eviction notice period and providing up to $5,000 per unit for moving expenses.
So the next topic is, go ahead. So you have
Thank you, Chair. Just a very quick question. So how long is the eviction notice period? Like not necessarily the eviction, but how far in advance are homeowners notified?
12 full months in advance.
Okay. Okay, good. Thank you.
You're welcome.
Thank you.
So this next slide is about the financial feasibility analysis findings. So a land economist has completed a draft financial feasibility analysis of potential new development in the city to understand a developer's capacity to offer tenant protection compensations. And the analysis is still in draft because it will inform several planning projects for the city. It'll inform the implications of stacking the costs related to density bonusing, inclusionary zoning, as well as the new development cost charges. So that's why it's still in draft. It's informing several projects, including this one. And we have Mr. Justin Bear, and actually looks like Will Volp as well from Urban Systems, Urban Matters. And they're here to briefly provide an overview of the analysis approach and results and to answer any questions you may have.
Sure. Okay. Thank you, Lisa. And can you hear me all right? Yes?
Yes,
okay,
please.
Great. So thank you for having me, and apologies I couldn't appear in person, but appreciate you making the flexibility for me to appear virtually. So yes, as Lisa mentioned, so we conducted a series of pro forma financial analyses specific to the tenant or the homeowner, the homeowner relocation allowance or protection policy, but also as part of broader economic testing work related to density bonusing, inclusionary zoning, and amenity cost charges, and other policy questions. Specific to the manufactured home community question, what we did is we looked at 2 case study areas of existing manufactured home communities. And as Lisa mentioned, there are many manufactured home communities, but we looked at 2 areas as sort of case study snapshots to try to represent sort of the breadth of kind of the high versus the low, existing values that exist in terms of underlying land value at these home parks in the community. So for each of these sites, we ran financial analyses to try to understand the development economics in general, and then the impact of different levels of homeowner compensation. So for these 2 case study manufactured home communities, rather than trying to, say, build out a complex phased development pro forma based on a speculative land use vision that's not fully formed yet, what we elected to do instead was within each of these, we took 1-acre snapshots of each of those and ran pro formas on that basis based on land use vision that was communicated to us by staff. So for example, on one of the sites, it's a 21 acre or so manufactured home community site with 145 homes on it. We took one hypothetical acre of that site and ran the development economics on that basis and inserted into our pro forma homeowner compensation on the basis of average units per acre. So 145 units across 21 acres in this case. We assume in our 1 acre snapshot that we are compensating for 7 of those 145 units. And then we modeled development of 2 different types. One, we looked at townhouse development, and 2, we looked at apartment development. And we looked at these at different density levels to try to understand, again, what are the development economics in general of building these forms, and then what happens when we start layering in the different layers of tenant or homeowner compensation. So to inform that pro forma analysis, we conducted market research on input costs and revenue opportunities for these development forms. Obviously, with these types of pro forma financial analyses, the value of the analysis is only as good as the information that goes into the model. So we wanted to make sure that we had a fairly strong understanding of the local development economics situation. So we looked at published data, we looked at data sources that we have subscription access to, and we also endeavored to interview as many local developers as we could to understand what are they seeing in terms of their costs of construction, what are they seeing and projecting in terms of revenue opportunities for sale or for rent for these units once they're developed, so that we make sure that we have a fairly realistic snapshot of what is actually happening in the market today. And then once we had built those pro formas, we then layered in 2 approaches to tenant compensation. So the baseline compensation was based on the $20,000 plus the assessed value of the units. So that would range from about $115,000 up to $260,000 in compensation per unit based on the 2 case studies that we looked at. And then we have the enhanced compensation scenario where the overall compensation value is about 2.5 times or more that value. Now, the findings for these case studies, these 2 case studies, are broadly similar to what we found in the 12 or 13 additional case studies that we ran, and which are right now in draft in the report, and which looked at the city more broadly, which is that this is, generally speaking, a fairly challenged time in the development community to make numbers work. So for townhouse development in general, what we were showing is that at the lower density, we're showing projects in the low to mid single digit profit on cost range, using average costs and average revenue opportunity. So that would generally be considered below a minimum viability threshold. Once we increase the density a bit to just over 1 FAR, projects do perform better. We start to see projects, townhouse projects, that are in the moderately viable territory in terms of profit on costs. However, again, that is before we layer in even the baseline homeowner compensation packages. Once we start layering in those compensation packages into the townhouse pro formas, we see a fairly sizable impact on profit margins, in some cases up to about a 12-point decline on the profit on cost. Now, that is a fairly substantial decline. If we were seeing outsized profits to begin with, this might be something that these projects could absorb. In the current market, where projects are quite marginal, it's probably going to be what breaks the project or prevents it from proceeding, at least at this stage. That said, the economics are already challenged, so the project may not have proceeded anyway. We ran the same pro forma approach for apartments. And again, layered in these different levels of homeowner compensation. On the profit impact on the apartment pro formas, it was less dramatic because we're spreading the costs over a much larger project, but we're still seeing a 2 to a 6-point swing on profit on cost, depending on whether we're looking at baseline or enhanced compensation. And against, again, background conditions of fairly challenged projects already, and sort of the single-digit profit on cost returns. It sort of underscores the challenging time that we're in. Had we run these analyses, say, 3 or 4 years ago, 2021 or 2022, I think the answers would be very different. We are definitely in a different place right now, and we will probably be in a different place again in 2 or 3 years. The question is, in which direction are the numbers going to go? I don't don't think anyone can clearly answer that yet. So we do the best we can with the data that we have available to us and the projections that we can make for the near term. And at the moment, this is sort of the reality that we're dealing with. Yeah, Lisa, I'll turn it back to you then.
Thank you, Mr. Bear. I can continue with my presentation, or if you'd like to ask a question now.
Mayor Krog.
Thank you very much, Chair. So, short answer is that based on the compensation that as exists under provincial legislation, et cetera, it's unlikely that any of the manufactured home parks in the near future, based on current figures, are going to see any redevelopment applications.
That's what our analysis is suggesting, yes.
And my question for Mr. Holm and Ms. Brinkman, Mr. Watt, Warren, whoever, what's the last manufactured home park we saw developed in the city of Nanaimo? Deerwood?
Yeah, maybe I'll thank you through the chair to Mayor Krog. So the last actually probably was Deerwood, but in fact there's currently a manufactured home community park, really small park, very underutilized land base wise, on Fielding Road that's going through a Bearland Strata subdivision process. So there is currently, I think it's a 6-unit park on quite a large portion of land, and I can't remember the exact number of lots that would be created, but significantly more than that, as a strata home ownership mobile home park, manufactured home park.
So it's strata ownership, which is not the same as a landlord owning a large property with individual lots on it. So it would be you would have the right to sell. You've got ownership of the land.
That's correct. And that's, again, it's going through subdivision process. That hasn't been finalized. We don't know the timing of that or whether it will be complete, but that is one that's in for development currently. Ms. Brinkman might have additional to add. Thanks.
Thank you.
Ms. Brinkman, you have anything you want to add to that, or do you want us to carry on with your presentation?
Sure, can do.
Thanks.
So the next slide outlines the engagement summary from the manufactured home community stakeholder group, but I know that Mr. Snyder is presenting next, so maybe I will let him share their recommendations. And also we have an engagement summary here from the Manufactured Home Park Owners Association, and there is an email in your package from them, and basically saying the provincial legislation regarding relocation of manufactured homes is sufficient. That's more or less their position, and that the proposed policy may impact the market value of manufactured home park properties. So that was a concern that they raised. So kind of a brief presentation, but really just showing we do have some polarized information. We have financial feasibility analysis, we have a manufactured stakeholder group and the property owners. And so we really try to put forward a policy that has kind of the right balance as best as we could, given the current market situation in Nanaimo, and but also trying to make sure residents do have some protections if they are displaced in the future, if that were to happen in Nanaimo. So happy to take any questions, but that concludes our presentation.
Thank you. I have a question from Councilor Carino, but I just actually have a quick question myself. And one was the first slide, it showed the number of manufactured home parks in Nanaimo, and the top two are on Metro. Are those captured in the transit-oriented areas for Woodgrove, or are they outside of the TOA? They look awfully close.
They are very close, but they are outside, but they are very close. You're correct.
Okay, so they still fall under suburban neighborhood?
Correct.
Okay, thank you. Councilor Perino.
Thank you, Chair. And Ms. Brinkman, you just touched on about the value of the property, right, of the manufactured home. Would it be a fair assumption, given what we've heard this morning about, this afternoon, about how difficult it would be to turn a park into, say, townhouses, how difficult that would be. Would it be a fair statement to make that manufactured homes at the current time are probably going to rise in value? Because it's not so easy to change.
Through the chair to Councillor Perino, great question. I don't know if Mr. Bear has a thought on that, but I think in general, property values have been rising.
Well, they have been, and you know, now that we know that these parks are much certainly safer than what I had realized, given the economics of trying to change them over to something else. So wouldn't that reflect that because they're safer, the value of them would increase? And I mean that as a positive. If I were as a homeowner, that would be a positive for me. Maybe Mr. Mayor wants to comment?
Sure, if I may. I mean, whether the value of the units will go up in value, I mean, it's a great question. I can honestly say I don't know if they will go up in value, but I can say that effectively what the economics are telling us is that right now the highest and best use, to use the terminology that's often thrown around in the industry, the highest and best use is what's on the site today, because the value of alternate uses simply cannot outcompete the value as it exists. So certainly if it's a question of protection from redevelopment, the economics of the day are in fact a protection from redevelopment.
So really what we want to do today, knowing that they're safe today, is make sure that the rules are such that we protect them for the future.
Once the economics improve and suddenly
Exactly.
there is an economic rationale to proceed, yes, absolutely.
Okay, thank you. Thank you.
Okay, thank you. I see no other questions, but I do have additional questions. I can see that 3 of the manufactured home parks in Nanaimo are in secondary urban centers. They're all in the south end. Are there any that are, so that would change probably the impetus maybe for the landowners. Are there any manufactured home parks being proposed for redevelopment at this time?
Currently, we don't have an application for rezoning of a manufactured home community, but as Mr. Holm mentioned, we do have one application for subdivision. So there are residents living there now, and as a condition of subdivision, there were conditions similar to the policy put in place to protect those residents who may be displaced.
Okay, thank you. Seeing no other questions, we have another presenter. It's Brian Snyder, if you'd like to come and present to council now. Okay, we have 10 minutes, and I will start the clock for you at some point for your presentation, and then there's time for questions afterwards.
Begging the chair and the council's indulgence, I have a little more than 10 minutes worth of work, and I think you will be interested in hearing it. So if I may just run a little bit over, I would appreciate it.
Okay, well, do your best
Thank you.
to attend. Thanks.
Mayor Krog, councillors, you'll remember me from 3 previous delegations advocating for manufactured home communities at our city. I am Brian Snyder, a homeowner for 8 years in Charmin Community, 6325 Metro Drive. I am chair of the Manufactured Homeowners Community Stakeholder Group, established at your direction by city staff to assist in the research and development of the Manufactured Home Community Relocation Assistance Policy. I note this issue appears under the heading Healthy Nanaimo, and so it should, as this issue is directly related to the health of our communities and the health of the 3,000 residents that live in these communities. I will make the comment, listening to the presentation by Urban Matters, that I never heard the word people in it. I heard profits. I heard investments. I heard development. But I didn't hear people. Our stakeholders group is grateful for the leadership of your staff, led by Lisa Brinkman and Warren Mann, in understanding our concerns and working diligently to help develop a policy for your consideration. A great shout out to you, Lisa and Warren. I would like to acknowledge the other 5 members of our committee, all homeowners in manufactured home communities in our city, 3 of whom are with me today. And thank you, Council, for the opportunity to speak on this serious issue that goes to the heart of our values as a city, our community, and our moral judgments as individual citizens. During this presentation, you will hear a lot of numbers. You may wish to write some down, and what do they refer to, as this may help you phrase some questions to clarify issues. At our first meeting with staff on April 10th, our opening statement to define the purpose of an objective of the proposed policy was, what if compensation plan was the highest and best use of people, not the land? In other words, protect, preserve, promote affordable housing for people. By initiating this project, and I think we've heard this morning, we all agree the existing provincial legislation is not morally fair or just for residents of manufactured home communities. So we have to do better. Let's phrase it a different way. Suppose you were a homeowner and you got an eviction notice in 12 months, and you were about to lose your home and your lifestyle. Among the other wonderful features, you might have a safe, secure, and comfortable home to live in, neighbors who check in on each other, peace of mind that comes from knowing you can afford to stay where you are, the community and services that you rely on for your health and well-being. And now you have 12 months to find new accommodation, pay for moving and relocation costs, establish yourself in a new community, locating and securing new services, specifically health-related. And doing this when you are 75 to 90 years old, which is 70 to 80% of the people who live in these communities. What would your reaction be to this situation? What will you do? Who will you ask for help? And where will you go? Of course, this is unlikely to happen to you, but it could happen to my wife and I, and for many others. But for now, all we have is the current legislation. So my question to you, and why are we here today? What is a life worth? Why do we have to do this right now? And you said it earlier, because the reason behind the need for a fair and just compensation policy is the hidden understanding the displacement of homeowners from these communities in our city is inevitable. The arguments in favor of our group's fair and just recommendations and data used in our analysis is included in the 2 reports included in your agenda package. One titled Manufactured Home Community Stakeholder Group Policy Recommendations for the City, and check pages 134 to 139. And fully comprehend our group's passion and motivation in doing the research and work behind our recommendations, please read pages 2 and 3 in this report. The second one was a concept of documentation analysis supporting Nanaimo City's relocation assistance policy. Key pages there, pages 140 to 2010. Oh no, 153, sorry. My presentation will focus on supplementing our information with more personal experiences and examples in relationship to our documents contained in your agenda package. These are centered around the concept of making a person whole, outlined on our report in page 135. We made 7 recommendations, which are on page 136, but will only refer to 3 of those. I will use the example of Crispin Bay development in Surrey to demonstrate the practicality of our recommendations and why they are above what is recommended by the city staff. But to fully understand how this serves as a roadmap, please review pages 141 to 144. That would be helpful. So this is the challenge in our city. Do you know that Nanaimo has the highest per capita number of homeowners living in manufactured home communities in any municipality in our province? Did you know that almost 20% of manufactured home communities in BC are on Vancouver Island? Do you know there are 896 of these in our province? So while I am speaking to you today, do not see me. See the 3,000 residents in these communities. See the over 4,000 residents in the Nanaimo Regional District, and see the over 65,000 that currently live in our province in these communities. There are many municipalities across our province who currently have some version of MHC protection policy. MHC, Manufactured Home Community. but none addressed the specific question of what is a life worth. Council initiated its policy by meeting and receiving a report from the manager of community planning on the subject of tenant projections project. And a councillor at that time succinctly pointed out tenants in manufactured home communities are homeowners and should be protected separately. So you have two policies to consider. So I asked councillors, as a manufactured homeowner, why do we need protection? Who do we need protection from? Pardon me. What specific protection do we need? I had a little fun analogy in here, but I was told it might be a little bit wild for this council, so I'm leaving it out. But under current provincial legislation, homeowners will suffer significant loss of equity in their home and be forced to find new accommodation at a large increase over their current monthly land lease fees. And partial protection is not an option. Complete protection is essential. We must do better than current legislation. And when we frame this issue as simply monetary compensation, we are really putting a price tag on human dignity and worth. And that price will always be too low. So the question for council is, what is a life worth? It's a question of morality, basic human needs, not dollars. What does it take to preserve the dignity, stability, and home equity and community for manufactured homeowners when they face the inevitable displacement from their homes and communities? Here's our recommendations. 2 times the assessed and appraised value, whichever is greater, an initial payment to the homeowner of 80% within 30 days of the rezoning approval, and the balance payable secured by covenant to the homeowner when they vacate the site, with up to 5 years allowed to vacate the site. Our group's recommendations are the most effective protections possible given the development pressures on these communities in our province. A comparison of our recommendations and city staff's is in attachment F, page 125 of your agenda package. In reviewing the recommendations of city staff provided today, we find that despite positive direction it provides compared to current legislation, there are a number of ways that we believe it can be improved further, some of which include the cost to move a home has been referenced to the policy, but the value associated doesn't compare with actual costs, which we have researched, and therefore is not fairly stated. It is also stated in policy recommendations that the majority of homes in the communities, due to age, cannot be moved. The average age of homes in our 20 communities is 46.7 years. There's a very real likelihood a homeowner won't be able to secure a mortgage for a new residence because they are unemployed and retired. 25% of the compensation paid upon eviction will not, in most cases, allow a homeowner to finance a new home, current city average $805,000, or even afford to rent an apartment, average rent $1,800 plus. The average monthly land fees that we pay as homeowners is $600 a month. It's a wonderful thing. The key benefits for the city, the development of homeowners based on our stakeholders group policy recommendations are outlined in the recommendation document sent to you earlier, and I can review these if you wish. A major one, though, will be the significant reduction in the involvement and work and cost for city staff, if you look at ours. All right, final issue. As we understand it, we never received a final report from Urban Matters supporting the rationale for staff's recommendation to pay 1 times assessed value. Based on their data, paying 2 times assessed value would make a redevelopment project unprofitable. In fact, some of their data indicates even 1 times assessed value would lower investment returns. The conclusion, homeowner compensation has a negative impact on the developer's sweet spot. That's their term. Comments by the executive director of the Landowners Alliance would lead one to believe this is true. It appears the homeowners, their families, their lifestyle, and their security are interfering in the landowner and developer's right to make a significant profit. I won't go into some of the, but if you look on page 7 of the Urban Matters presentation, they give that little table and they talked about these hypothetical ones. Apparently they were talking about my community, Charmin. 145 homes, 21.3 acres, Current assessed value of all homes, $35 million.
If you could wrap it up, please. I've actually let the clock run a little bit over.
Well, I appreciate it, but let me finish with an example.
Okay.
Okay, what is a life worth? So let's consider the real-life example of Crispin Bay Manufactured Home Park in Surrey. Once home to 191 manufactured home households, all seniors, is now in the process of redevelopment. And I sent you a full detailed analysis of that. So the developer purchased the land, 23 acres, in February of 2022 for $95 million. That's $100 a square foot. Remember that number. Interestingly, the land value in 2016 was $22 million. Boy, if they bought it 4 years earlier, they could have made a million. And the council, Surrey Council, approved the redevelopment Q4. I'm sure many rumors circulated during this period of time on the insecurity, anxiety, and the unknown for the homeowners and their families. So the developer made a buyout offer of $250,000 for a single-wide unit and $300,000 for a double-wide unit. Homeowners would receive 90% upon receiving a 9-month notice to vacate, with the balance 10% upon vacating the site. 9-month notice eviction was scheduled for 2028, but with no confirmed date. This assumes the development timelines were met. It should be noted that the average age of homes is 46 years, and 151 homes in that community are over 50 years old. Some homeowners accepted the buyout, but the assessed value of all 91 homes in 2022 was $24,835. If you calculate the buyout value of 54 double wides and 137 single wides, it comes to $50,200,000. In 2022, when the project was first announced, the homeowner buyout was 2.01 times the assessed value. Was the developer overly generous in paying 2 times? Did they just forget to include the cost in their development investment calculations? Or was this a manageable cost in their overall development? Also, did it avoid considerable negative publicity for the city and the developer? The answer is yes. In the case of Crispin Bay, detailed analysis of compensation payouts compared to assessed values demonstrates the developer did not consider homeowner buyout at 2 times the home assessed value. Now, I know Nanaimo is not like Surrey. However, the city expects to create homes for another 30,000 to 40,000 new residents in the next 25 years. Where are you going to put the needed 12,000 to 15,000 homes? What kind of homes will they be? Who might be displaced to make room for these new homes? Some interesting facts to consider. If you check your 2025 BC assessment report and do a bit of calculation, you will find that the land your home sits on is assessed around $50 a square foot. My home sits on land I do not own. The assessed value of this land is $11.21 per square foot. Which land do you think would make a good investment for the replacement of affordable housing with high-density housing? Let me conclude with a brief history, if you'll be patient.
We're running well over time now, so.
Yes, but this is a panel for robust discussion and debate, and
please go ahead.
Thank you. We want just this equal time to everyone else, I guess. So in 2009, an Ohio City Council similar to yours faced this exact same challenge, resulting in an 8-page staff from D. Lindsay, Planning Manager, to A. Tucker, Planning Director. The objective, require a tenant relocation plan as part of any application to rezone an existing manufactured home park. Staff's recommendations at that time were moving expenses, include relocation and service connection costs, somewhat covered in today's recommendations. Compensation for loss of equity, not covered in today's recommendations. Compensation for the difference between current housing costs and pad rental fees versus the monthly housing costs following relocation, not included in these recommendations. Compensation for the time and effort involved in finding alternative accommodations. These recommendations 16 years ago were stronger than today's. The Council's decision in 2009 was to recommend the provincial government change the legislation to include staff's recommendations. It would have been wonderful. The letter from then Mayor Corpin to Mr. R. Coleman, then Minister of Housing, requesting this was copied to Councillor Leonard Krogh. Mr. Coleman is still contemplating this request. So here we are in 2005, 16 years later, after what the council requested, which they have not accomplished, the government. Will we wait another 16 years? I'd like to leave you a couple of thoughts to consider as you consider your course of action. In 2023, the UBC Law Review released a study titled Tenant Protections in Mobile Home Park Closures. Recommended reading for all councillors and staff. I quote, "In mobile home park closure, the landlord is able to force the tenants to abandon their property rights in their mobile home, as long as it is evicting the tenants for one of the reasons recognized in the legislation. In 9 of 13 Canadian jurisdictions, the taking of the home occurs without any form of compensation." And finally, if you were on the island in 2004, you probably heard of the closure of the Qualicum Bay Manufactured Home Park, home to 65 households at the time. A case study was done on this, and here is one of its conclusions. Community impact. Local and provincial media, CBC News, Times Colonist, documented broad community disintegration, psychological hardship amongst seniors, and neighborhood fragmentation from this closure. The community disintegration led to changes in legislation for providing 12 months rent for homeowner compensation, which in 2004 was $4,000, to the $20,000 we now have. But this legislation was only changed in 2018, 14 years after. Based on the information we have presented this morning, we kindly ask City Council to recommend staff continue to meet with our stakeholders group to further consider our recommendations and the information presented today, with the objective of preparing amendments to the policy that go further towards providing fair and just protections for displaced homeowners. Thank you for the opportunity to speak with you today, and I apologize for going over. Happy to hear any comments or questions.
Well, thank you, Mr. Snyder, and actually thank you for all of that research. I did read everything that you sent, and I appreciate you digging in and providing those numbers. I don't see any questions right away, but I do have a question for you, and that's just about Crispin Bay. Was that a decision by the developer, or was that Surrey City Council?
Surrey City Council did not have any specific things. They said you had to do something. It was a developer's decision. The publicity, negative publicity, if you read through the articles, if you do a little search, would have been very nasty.
Yeah.
There were all kinds of churches and things involved, so.
Right. Do you think, given the change in buying out a mobile home park at that level, I know you've sent us many emails in the past promoting manufactured homes as a way to create more affordable housing in the community. Do you think that Surrey will ever see another new mobile home or manufactured home?
Absolutely not.
Yeah.
10 years ago, there were over 30. There's less than 18 now. In 10 years, there will be 0.
Right.
There is none in Vancouver. There's none in Burnaby. There's none in New Westminster. There's none in North and West Vancouver. The urban centers. And I don't know where our future in our city lives, and I won't live that long to see much of it. But it will happen here, for sure. And you just need to look after the people, not the profits.
Yeah, I definitely get that point, and I can understand the stress that people would go through in a situation like that. I do have some questions now. I'm going to start with Councillor Gesselbrock.
Thanks, Chair, through you. Just with the Surrey example, I mean, maybe this is a question for staff, but I imagine like so there was no regulation of the Surrey municipality on requiring that the protection that existed for that mobile home park basically was sort of like the baseline of what the province has,
Yes.
which is payout for assessed value.
Correct.
And so the developer went above that.
The developer went, yeah.
Compared to and the staff, compared to the value of the property in Surrey, compared to the value of a mobile home park here, what is the difference, per acre of the land value there?
Yes, well, as I said, we're not Surrey yet, no, but you do have to find room for a lot of people in the next 20 or 30 years. The actual value, we've done a financial analysis. I'm quite frankly not impressed with Urban Matters in their work. And the profit value for that development is huge. I don't have it right in front of me at the moment, but I can send it to you if we didn't already include it. I thought I had it here, sorry. Too much paper, right? By the way, I provided to your staff, and given it to you at some point in time, details on every manufactured home community in our city, and there was no reason why Urban Matters didn't have all of that information and could have done an actual analysis complete. I have a friend in our community who worked as a accountant for the government for 40 years. He's very good at these numbers, and we've ran quite a few. So we have a good idea of what the investment value is down the road. I think the developer is looking at hundreds of millions of dollars of profit within the next 20 or 30 years.
So I guess the follow-up question is just, like, given the Surrey case there wasn't actual requirements for the developer to pay 2 times, was it basically like just public perception of evicting the current tenant landowners in the park that motivated that level of payout?
Of course, I wasn't there at the time. I had heard about it, and I was quite impressed and amazed because I've been involved in advocating for these communities for over 5 years. And reviewing all the literature, it simply appears that the public perception was they had to do something. I don't know where developers sit on your scale of individuals, but they're not too high on mine. When is a developer going to give up? You were talking parking today. Well, let the developer do it. The developer doesn't have the best interests of the city in mind. It's a nice thing to say, perhaps. So you need to have a plan and say, yeah, but this is what we're doing in the future, so this is what you have to make do with. And I think it's the same with the manufactured home communities. You need to have a plan and says, look, we're looking after these people. This is what we'll do.
Good, thanks. I've got a question for staff, but I'll...
Okay.
One thing I would say, in looking at our proposal, we're saying just give the money to the individual homeowner. He will look after himself. You don't need a relocation coordinator. The developer doesn't need to negotiate with every homeowner on how to try to do that, and certainly not against a 85-year-old widow with Alzheimer's who lives across the street from me. Let people decide what's best for their life and give them some time to do it. That's all we ask. Okay. And then at that point in time, everybody will be happy, but we're going to have to move, right?
Okay, I have 2 more questions, Councillor Perino and then Mayor Krogh.
Thank you, Chair. Appreciate. Mr. Schneider, thank you for the presentation. It was very thorough, and I appreciated that. I just have a couple of questions for you about your group recommendations. So what you're saying is that it should be 2 times the current assessed value, whatever that is.
Yeah.
Is that right?
What we think would work is, because assessments are a strange thing, and when you're older and you live in a home and you feel you're secure, you don't necessarily look after your assessment value.
Yes.
And BC Assessment, quite frankly, I've done a lot of research with them. I've talked to their chief executives. I have no, their formulas are, anyway,
okay.
That's another whole talk to be fun. So.
But that is your suggestion, is the 2 times?
Yes, well, that's correct. But what I'm saying is, let the homeowner look at it and say, well, I don't think my home is assessed correctly. Can I get it appraised? And let the homeowner pay for it. Okay. But at that point in time, the developer has to accept it. That's the number.
Okay, so you're saying they have to accept the 2 times whatever those,
yes,
either one of them
I
is.
think it's the developer's choice. We'll do that or we won't do that.
Okay. The other piece that surprised me was the 80% payment to the homeowner within 30 days after rezoning approval. Why would you necessarily, like, I understand that the purpose is for relocation, so to put a down payment or something on something else.
Do
is that
something,
correct? Yeah. Are you suggesting that the money be just given carte blanche, or that it could be paid towards something else. My concern is, do you just want them to receive a check? Is that what you're thinking?
Yeah. Let them look after their own lives.
Okay.
Okay?
Okay.
I mean, that's not that hard to do. And the positive for the developer is, I'm likely to leave sooner and they can get their shovels in the ground sooner.
Mhm.
All right?
Mhm. Okay.
One of the things in the Crispin Bay is they have to continue to pay rent. That's $2 million a year. That's $10 million in 5 years before they have to pay out anything.
So you're saying pay the 80% as well as pay the full rent for up to 5
No,
years?
no, I would encourage that the rent stays. Just what we recommended was don't increase the rent.
Okay.
Okay, but you don't want to encourage, because if I got rent-free for 5 years, I'm happy as a kid, right?
Yes,
So
that's right.
we have to be, we are trying to balance things and in the developer, not take everything away from the developer. But
Okay.
from what we've seen of the numbers, 2 times assessed value is not, if it's the right development, and the developer will figure that out.
Mhm.
That's their job.
My biggest concern for homeowners today, given what we've heard today, is I want you to feel, I want your groups to feel safe in their homes. And so that's what we're trying to achieve, I think, at this
Yes.
table. Yeah, thank you.
If you don't think of any of these things, which probably most of the homeowners don't, and my wife is always, don't scare people, please don't scare people and tell them they might lose their home. And that's true, you shouldn't. So most of these people, most of the homeowners, will not be aware of that they are threatened. Take Southgate, all right? The lady that was on our committee has sold their home to get out. Well, 2 reasons. 1, that they know that it could go, and 2, that the place is so badly managed that it's terrible. And that the city would have let it exist. I know they've complained and stuff to the police, and it's a mess.
I appreciated your comment that we don't talk about people as much as the profit. Thank you so much.
All right.
Okay, thank you. Mayor Krog. It's coming.
Thank you very much, Chair, and thank you for the presentation. And I'll tell you where I'm having a lot of trouble with the concept of double the value because you placed personal property on somebody else's land. I find that a bit challenging. The province has decided that compensation is the assessed value of someone's personal property, and it is personal property, it's not real estate. And you're asking the city of Nanaimo in particular to, if you will, double that compensation. We know that Deerwood was the last manufactured home park created in this community. We know that the only proposal forthcoming now is one that involves Bearland Stratas, so you won't be buying a manufactured home and plunking it on a rental property. You'll be buying a lot and putting a manufactured home on that property. No one's in any substantive number, and none in this city apart from that are building manufactured home parks. And I guess my concern is we may make all of the people in the city of Nanaimo feel a lot better, but if this is the first community that does it, others will follow. Everybody thinks something's a good idea, and everybody else wants to follow. The end result of this will be that you will see the current ownership compensated, in my view, beyond what is reasonable, to the detriment of long-term, low-cost housing, which historically manufactured home parks have provided across this province, because no one's going to invest. No one is going to invest. Why would I do that? If I developed one today and fixed a reasonable rent, and you plunk a $200,000 manufactured double wide on it, and in 5 years I decide I'm going to consider redeveloping, but I've got to pay you $400,000, we'll say, I'm not going to redevelop land. Now, you will argue that's exactly what's going to happen. We don't want these places redeveloped. So you will prevent that redevelopment, but the overall impact will be that no one else is going to develop any of these anyplace else because it doesn't make sense. And this is all at a time when I am meeting fairly, I won't say regularly, but have met with several modular manufactured home owners, operators, proponents who are trying to see society as a whole develop more of this kind of housing because it is cheaper than regular stick-built single-family dwellings. So I want you to understand where I'm coming from on this, and do you disagree that this is not going to, or agree that this is not going to promote the creation of more manufactured home parks, which have historically been a source of low-cost housing?
Well, I would disagree with you that. If you look in our city, most of these communities are well over 40 years old, and they have generated enormous profits for the owner, the landowner. And if I was a developer and I were thinking of creating one and then getting out in 5 years, I don't think I'd be a smart developer. So that type of scenario I don't think is likely. One other issue here. In the creation of this community, all right, and that is why it's affordable, shared cost of land, shared cost of the home. So a landowner says, I've got a piece of property, I'm gonna put some services in, I'll mark off some lots, and now I'll get someone to buy a house and they put it on the lot and they pay me to be there, all right? So it's a beneficial help to both people, and the cap rates on these communities are very good. You can check them out, they're excellent. So you have a beneficial relationship between two. In our community, Charmin, I mentioned the assessed value of our homes is 35 million. The assessed value, land value of the community is 10.5 million. We have 3 times the investment that they have in it at the moment in time, and it's a beneficial arrangement. So if he decides to close it, why should he benefit because the land prices go up or because the Urban Matters says that, well, the developer will make a lot of money, and I have to suffer because I lose my home? This is benefit both parties. You're fair, you're equal, and after 25, 30 years, they've made good money. The mortgage is paid off, and in actual fact, I check every one of the communities in here. I can tell you exactly what their costs are to run the place. I can tell you how much income they make, and I can tell you what they're generating each year. So I know these things, and I can put them on your desk. So I would think that let's look at the beneficial arrangement of both parties, and if something wants to change, let's make sure both parties are treated fairly.
Okay, next, I have a question from, did you have something, Ms.
Oh,
Gary?
no, Mr. Chair, I was just going to remind you that there still is a delegation waiting to speak as well, so if there's questions for Mr. Snyder,
I
now
can
is
yield the
appropriate,
floor.
but yeah.
Okay, and the delegation, just correct me if I'm wrong, delegations are 5 minutes for?
They're 5 minutes, yes.
Okay, thank you. So are you finished, Mayor? Okay, Councillor Hammonds.
Thank you, Chair. Thank you, Mr. Snyder. Quick question for you. So 2 times the appraised value, 80% of the costs within 30 days.
Of rezoning approval, yes.
And 5 years that you can stay on that land? Is
Well,
that?
we'd like 5. It may be much, but start at the top and work down.
So in that situation, someone who's rezoned has put out 80% of the value of the manufactured homes on their land, but they're restricted to not developing for 5 years?
Well, that would be the case if I hung around. But put it this way. If you didn't pay me enough, you'd have to drag me out of my house. All right? I'm going to scream and yell and kick and get a lawyer and whatever else I'll do. What you want to do is if the developer says, let's go, if it's good for the city, then let's help these people make decisions in their lives and move on. That's all we're saying. And they are the best ones to make their decisions for their life. Now, there are people in these communities that would be hard-pressed to make a good, positive financial decision or to even decide where to go. And there are, seniors advocates and ombudsmen and so on, and there are support services in our province that can help these people make decisions. A relocation coordinator, do you know what the requirements are for a relocation coordinator?
No.
Do you know what skills they need, what experiences they need?
No.
There's only one I ever knew about in the province. He worked for the Langford, the Triway system. Not Triway, the new one in Langford that's going in. The city hired him to do something. I checked his credentials. I don't think he knows anything about manufactured home communities or something. But at any rate, I tried to contact him 2 times, and he wouldn't contact me because I wanted to put him in touch with Lisa and Warren, because there's a relocation coordinator.
Okay.
But I don't know what you'd find, you know, how much is he gonna cost? And how do you talk and negotiate with, in our community, 145 homeowners? Every one of them different. Some have only just arrived there. Some have been there 25 years. Some want to die there, like me.
Thank you.
Yeah.
Okay, well, thank you, Mr. Snyder. Appreciate your presentation, and appreciate all the research you've brought to us at council. Next, we have...
Email me if you want to know anything more.
Okay, will do. Next, we have Susan Belford, Active Manufactured Homeowners Society via Zoom. Welcome, Ms. Belford. Please go ahead.
Hi, thank you so much for having me. Just a word about the Active Manufactured Homeowners Society. We're a provincial nonprofit. We're volunteer run with a growing membership of 450 homeowner members, and we advocate with provincial agencies and organizations for approximately 65,000 owner residents of manufactured home communities here in BC. I'd like to thank the City of Nanaimo hugely for embarking on this policy discussion. In creating policy to protect the interests of manufactured homeowners in Nanaimo, you may be setting a standard for the province, and that's exciting for us. I just wanted to say, you know, who are manufactured homeowners, given some of the stereotypes? I just want to speak to that. Most MHOs, as we call ourselves, are mostly retired people who have had full productive lives in the professions and skilled trades. Most of us sold our single-family homes and purchased less expensive manufactured ones to downsize. The pad rents fall affordably between strata fees and market apartment rents, and the community layout provides more privacy and personal space than a condo or apartment building. About a quarter of manufactured homeowners are heads of households with children, and these families also obviously benefit from the increased privacy and outdoor space available in manufactured home communities. Some of us have lived in our homes for 10, 15, 20 years or more, and we have established networks of neighborhood friendships and support. Most of us maintain and update our homes regularly and keep up a pleasing appearance. And while some of us have substantial savings or employment pensions, there are also many of us living in poverty with savings depleted, and many of these are frail, handicapped, and extremely old. These are among BC's most vulnerable citizens. Just turning the page. Manufactured home communities embody a mutually beneficial relationship in which investments by the homeowner benefit the landowner and vice versa. Unfortunately, this mutuality seems to disappear when the landowner closes the community for rezoning and redevelopment. Suddenly, only the homeowners seem to be at risk. Now, Ms. Koch of the Park Owners Alliance is incorrect when she states that the legislation favors the rights of residents. While the legislation states that a landowner must pay the homeowner a prescribed amount on or before the effective date of the eviction notice, so right before they got to leave, there is little direction on how this is to be carried out. And so it's possible, under the current legislation, for an unrepresented, frail, elderly person with a home assessed at $250,000 to be evicted and left with nowhere to go, with a mere $20,000 to $65,000 with which to find another home. Now, this is unless they're able to successfully appeal at the Supreme Court of BC. That also would happen after they've left. So there's this big hole. The legislation also allows landowners to deal with the many homeowners within a single community separately from one another. So this creates a patchwork of agreements and builds in lack of fairness. The impact of such closings on individual homeowners is a severe upheaval. They are to be forced to leave their homes, lose their personal and financial security through a process that is sometimes protracted over years, years of uncertainty. This results in damage to physical and mental health. The impact of such closings on a municipality is also substantial because it's going to be challenging to accommodate multiple families simultaneously facing relocation during a housing crisis, eh?
1 minute left.
Yep. This policy is designed to provide fairness and certainty to homeowners. And, no, I've lost my place. It does so in most ways, the one that you're discussing. However, the stakeholders remind us that such forced relocation by rezoning is a form of expropriation, and therefore should require the remedies laid out in BC's Expropriation Act to make the homeowners whole. The 2 times market value suggested by the stakeholders sounds like a lot until you realize that it will help to defray not only the cost of finding a new home and moving into it, but also the many hard to quantify unexpected costs that displaced people experience, such as increased transportation costs, the loss of friendships and support networks, perhaps needing to find a new doctor or dentist, and of course, increased monthly outlay of higher market rents or higher payments on a new mortgage. I understand the need to balance interests, however, and once again, I want to commend the City of Nanaimo for taking this on. Thank you.
Okay, thank you, Ms. Belford. Are there any questions? I see Councillor Perino.
Thank you, Chair. Just to Ms. Belford, thank you for your presentation. So are you suggesting that the recommendations that the city has for us to debate today is adequate?
I think it's a step in the right direction. I would like to see you consider some of the stakeholders' recommendations a little bit more fully, because I don't think that I don't have them in front of me, but the sort of 25% and the assessed or appraised value, I don't think that's really adequate. But, you know, it's a step in the right direction. And I personally would say, well, if it's between that and nothing, I'd say we'll go with that. Okay. But I would urge you to reconsider some of those questions that we've been discussing.
Okay, thank you.
Any further questions? Councillor Eastmere.
Thank you. Thank you for your presentation. And I wanted to ask about specifically the financial compensation related to moving the manufactured home. The policy suggests that if the owner does not choose to sell the unit and it's moved to a new location, the policy would provide financial compensation to help relocate it, $10,000 for a single wide and $20,000 for a double wide. Does that sound like an adequate amount to cover the cost of moving something? Do you know how much it would cost?
I don't know precisely how much it would cost, because it depends, of course, on the dimensions of the single or double wide, and it depends how far it's got to go and how challenging it is to get it out of its current location into its new location. So there's a lot of different variables. But my sense of it from watching movement inside my home community is that those figures are pretty low, and they would not cover the cost of moving. The other thing is, where can someone move to? Because there aren't a lot of manufactured home communities that have space.
Thank you for your perspective.
Okay, are there any further questions for the delegate? Seeing none. Thank you, Ms. Belford. Appreciate
Thanks so much.
Appreciate you sharing your thoughts with us. Thank you.
Thanks so much for your time.
Yep, questions for staff. Councillor Perino.
Thank you, Chair. Again, something that Ms. Belford talked about, the relocation expenses of moving these homes to another location, if it can even be done. Have we verified that those prices are consistent with what the market is today?
Councillor Perino, through the chair, I can answer that. I did talk to Nightway Mobile Haulers in Duncan, and they provided a base price for moving, so the starting price at $5,500 for a single wide, and $12,000 to $14,000 for a double wide. So this includes taking the home and putting it on blocks. It does not include tie downs, skirting, vapor barrier, other things that someone would likely want to have their home established on their home when they get to the new location. Okay. The other thing is during the process of moving the home, it's quite likely there's going to be some kind of damage, whether it's broken windows, if they're double pane, broken seals, some damage to plumbing. Some of the homes have been drywalled, so there's going to be damaged drywall. Those numbers we thought were too low, and that's why we came up to the $10,000 and $20,000 figure. And again, this is in addition to the $20,000 that the BC government makes for mandatory compensation at the end of the Tennessee.
This is in addition to the BC?
Correct.
Okay. Okay, thank you.
Councillor Hemmons.
Thank you, Chair. Through you to staff. I'd just like to understand better under financial compensation cons point 2. It reads, it's important that the policy contain realistic compensation requirements to encourage responsible redevelopment practices. This is the important part, so that the property owner developer does not choose the alternative option to close the park, evict the home to the manufactured home park tenants, and redevelop or apply to rezone or subdivide long after residents have vacated the property. So what would prevent a property owner from doing that at the outset? Like, why would they choose to go down this route of a tenant relocation versus just evicting everyone? Like, please help me understand that a bit more.
Through the chair and to Councillor Hemmons, and thank you for asking that question. And that is one of the main reasons why staff isn't recommending some of the manufactured home stakeholder group as far as the 80% payment and the 2 times, because we want to create a policy that is realistic and that a developer, property owner will be inclined to follow. And I think, when there is a rezoning process, the city, including staff and council, is considering many things from that rezoning applicant. We're looking at design, we're looking at density, we're looking at height, we're looking at park contributions, all kinds of things. So a rezoning applicant does want to do the right thing. And a lot of them, too, may know the residents of the community. They do want to help people move. So the policy is to encourage them to do the right thing, not to encourage them to ignore the residents altogether, or, to do the very provincial minimum. So we want to create a policy that's realistic and encourages them to help residents in the best way that they can. Does that make sense? Is that helpful?
I think so. So provincial policy would say this is the base minimum you can do. City of Nanaimo is saying we need you to do a little bit more.
Correct.
But I'm also hearing this option that they could just evict everyone.
And that is correct. They could do that. They can always at any time choose to close a park, and the city has no role in that decision. So that can happen at any point in time.
So they close it, they evict, they sit on it, and then when everyone's gone, they go to redevelop it, and they don't have to do any of this.
Correct.
Okay, thank you.
Any further questions? I have just a quick question about inflation. How do we ensure that we build in inflationary costs for moving a home? So we set the 10,000, 20,000. What are we going to do in 10 years? Are we going to keep coming back to council with decisions based on inflation, or is that built into the system?
To Councillor Manley, yes, I think it is important to review the policy, and we do have a line there to review it every 4 years. The market changes, just as Mr. Bear mentioned. Even 4 years ago was a different development market in Surrey, but also in Nanaimo too. So even, 4 years ago in Surrey, there may have been that land lift available to a developer to pay out. I don't know if that is still today. So it is worth always reviewing our policies, all this for that reason, and to relook at compensations in the future.
Okay, thank you. Councillor Perino.
Sorry, Chair, I'm back with another question. It's just something that Councillor Hemmons talked about. So it is possible that a landowner of these parks, of one of these parks, could in fact evict and then later down the line redevelop. And you're saying that is correct? Is there no protection?
There would be the provincial act requirements, the Manufactured Home Park Tenancy Act. And in some cases, if a resident is renting the manufactured home, then the Residential Tenancy Act would apply in that situation. If they weren't applying for a rezoning application or anything to the city, then the provincial requirements would apply.
Okay, so when we're looking at this decision, what you're suggesting to us is that we need to balance the need of the landowner to ensure that they take care of the residents. Okay, thank you.
Councillor Gesselbrock.
Thank you. I mean, just hearing, okay, if a manufactured home park owner wanted to evict everybody, they could, but there's the provincial requirements. Like the provincial requirements on paying assessed value, does that still hold?
That's correct, and I turned over to Mr. Mann because he really understands that's actually quite an onerous process for the manufactured homeowner to obtain that assessed value. And so that's why the city policy is kind of simplifying that process, but maybe you'd like to explain how that works.
Yes, Councillor Gesselbrock through the chair. When the manufactured home owner who's a tenant on the pad gets their 12-month notice to vacate, they will get the $20,000 at the end of their tenancy in compensation. They have to be proactive, and within 15 days, they have to apply to the RTB for an arbitration hearing and request a monetary order for the value, for the tax assessed value of their home, but they have to prove that there's nowhere to move it to, or they have to prove that it's not movable, that it's too old, it doesn't meet code. So this process, it puts a lot of stress and work, proactive work that a homeowner that, as Brian Snyder mentioned, a lot of these are elderly people, a lot of these are just people have never had this kind of experience where they have to go to court or go to an arbitration hearing. So it's not really fair that they would have to go to that. That's our opinion.
Okay, great.
Did that answer your question?
Yeah.
Can we extend the policy to evictions rather than just rezoning? Because right now the policy is for rezoning. Can we not extend it to for evictions as well?
Under the Local Government Act, I don't believe a municipality has that ability.
Okay, thank you for that. Councillor Eastmere.
Thank you. I saw Mr. Snyder's hand go up in the audience, and I wasn't sure what that meant, and I know it's not necessarily appropriate to, because your presentation is completed, but like, is there an additional comment from the presenter? Because I'm really interested in getting this right. So I'm trying to like read a signal from the audience here, and I don't know. Did you have something additional to add or a comment? And if you do, please. You'd have to come speak to the microphone just for accessibility reasons.
I think Mr. Mann very adequately answered that question with regards to the stress on individuals.
So the hand up was
if you actually read the legislation, they don't have to do anything other than say, you're leaving in 12 months and your home is mine. They can apply for possession of the home, and now they have the home and you're gone. So the actual legislation is very poor, and I think I said that right at the start. But Mr. Mann answered that question quite clearly. That's what would happen.
Okay, so, yeah, like I'm struggling with this because we're trying to make it better, and it's obviously not going to be perfect or really be able to fully compensate, because you could never, I think, properly compensate someone for forcing them to leave their home or where they live against their will. But I think this is a step in the right direction, and trying to split that difference so that, yeah, I guess I can't speak to it really because the motion's not even on the floor yet, so.
Yeah, well, you don't want to incentivize evictions.
Yeah.
Mayor Krog.
Thank you very much, Chair. And just to be clear from staff, please confirm what's already in the report, but for the public record and those listening, that the proposed policy streamlines the process, reduces the burden on the manufactured homeowner by requiring the applicant to pay similar financial compensation as is required under the Mobile Home Protection Act, such that the resident does not need to prove that they were unable to obtain the necessary permits to move the home. In other words, this is, in my respectful opinion, a fairly substantive improvement on the provincial legislation, and that is the proposed policy, correct?
Through the chair, that's correct, yes.
Thank you.
Somebody did you have another question, or you want to make a proposed motion? Okay, so Councillor Eastmere moves the staff recommendations. Is there a seconder? Mayor Krog, would you like to speak to it, Councillor Eastmere?
I think this is an improvement, and will help when people are put in a very difficult situation. It's not one that I ever hope that people are put in, but as we see redevelopment and growth, there is a possibility for this. I think it addresses concerns of people who live in the mobile home parks, and also takes into consideration the concerns of developers. I do think that keeping people housed where they wish to live is my priority, and I'm glad to see that there's additional financial compensation and support included in this policy. I think it's a step in the right direction, and if we see that changes need to be made, and if we have ability to improve these conditions in the future, I would be happy to do that, but at this point I think this is a good step forward.
Thank you. Councillor Gesselbrock.
Thanks. Chair, through you. Just thinking through this, basically these manufactured home parks are supplying critical affordable housing. And affordable housing is something that we've been unable to create in this community. We are well below our below market value housing, and the stock that gets built doesn't meet that affordability threshold at all, because just the market really currently can't support it to build it privately. So basically we have to look for government subsidized housing to build anything that's affordable. So for myself, I don't really see any benefit of having these mobile home, to the community, these mobile home parks redeveloped. None of the mobile home parks currently exist in urban nodes, which we are trying to focus the more densified housing, where it would potentially make sense to redevelop it. So I see no urgency. What I do see is that, yeah, homeowners in these parks aren't adequately protected, and there is still the chance to be able to scoop something up and develop it at the cost of individuals' livelihoods. And I don't think that is fair. And so I do think it's in the best interest of our community to protect these sites as much as possible. And really, it is a financial thing. If you set the payout at assessed value, you can see it's sort of just on the threshold. Maybe it could be redeveloped. You know, most likely in the current economics, it won't be developed. If we move that threshold to 1.5 of assessed value, it would decrease the likelihood in the short term that it would be developed. If we increase it to 2 times, it would decrease it even more likely to develop until the land value is at the point that probably, like in larger centers, say Surrey, where it's like, you know what, I'll happily pay 2 times the assessed value to redevelop because it's worth it, and wait to that. And so I can't support the policy as is. I'd put an amendment that we change the policy to 2 times the current assessed value and do 50% of the purchase payment within 30 days, which is, so I'm going to put that amendment forward.
Do we have a seconder? There's no seconder? Okay, so I have Mayor Krogh up on the speaking list.
Thank you very much, Chair. I appreciate the presenter today won't be happy with the result of this vote if it goes the way I think it might. But the ball has been advanced down the field. I appreciate Councillor Gesselbrock's attempt with his motion to meet the request to double. But I would remind everybody that this is still private property. Manufactured home parks are subject to rental controls. And yes, we've heard some sad stories, but there are some nice stories. You sell your single-family home in Nanaimo, you buy a manufactured home for, say, a couple of $100,000, quarter of the value of your average home in Nanaimo. You reduce your housing costs significantly. You free up $600,000 worth of capital. With great respect, you're a senior citizen like me, and you pass on within 5 or 10 years, and your estate still has its capital, and the manufactured home is probably worth not much less. And if the market goes the other way, historically, manufactured homes follow the market, just as manufactured homes follow the market down as well. It's not a form of housing that I've ever suggested to clients, and have said, you know, it's a risk you take. And it's particularly risky if you're a senior, but maybe you make up your mind that it's worth getting the equity out of your house as opposed to a reverse mortgage or whatever. So I understand the comments about, you know, these are human beings, but we all make our choices. And it's pretty clear that in the current circumstance, you are not going to create more housing by what Councillor Gesselbrock has suggested or what the presenters have suggested. You are in fact going to discourage anyone from ever trying to develop a manufactured home park because you will be looking at some potentially significant compensation. Where else in the marketplace do you get guaranteed double the value of the property, to use the language that was used, that's expropriated from you? Where else in the world does that happen? So I think we have to be realistic. It's not perfect from the point of view of what people want, but it is certainly a substantive improvement over the current situation where the onus is on the homeowner as opposed to the park owner. In addition, the compensation for moving will become meaningless because, candidly, most of these homes are not capable of being moved. Many of them in our older parks, they are never going to be moved and will not be moved as a result. Yes, will people, quote unquote, lose their homes? Yes, but they will have compensation in the return of their equity in those homes with which to pay rent, as many are forced. You're not going to force the private sector to create the low-cost housing that is the responsibility of us as a collective, as a society, as government. You're not going to force the private sector to provide that by putting more and more restrictions on the private property of existing manufactured home park owners or landowners, or what Mr. Snyder referred to, I think it's fair to say in an uncomplimentary way, as developers. Well, there's not a soul in this city who isn't sitting on a chunk of property, whether it's a rental building or a piece or a single-family dwelling that wasn't created by a developer at some point. So we may not like them. I'm certainly not in Mr. Snyder's camp on this. We may not like them, but that's the way our society has developed. So for what it's worth, I support what staff has worked hard to create, and I compliment them for their patience and their efforts in this regard. This is a progressive step forward in order to protect an existing class of owners who, based on what we've heard from Mr. Holm, based on the numbers in Nanaimo, are a diminishing group of people, because no one is going to build more of these parks within the city of Nanaimo because it is uneconomic. Thank you.
Okay, I have Councillor Hammonds and Councillor Perino, but can I just inject myself for the question here? I've read a lot of material on this particular item, and one of the things I was reading was that in some cases the rezoning includes a number of affordable homes, and that some of those affordable homes would be attached to a first right of refusal for people who are being evicted. That's not part of this policy, but is that something that we would consider in a rezoning application?
Thank you for asking that question. We did consider including that in the policy, and there was 2 reasons we didn't end up putting it in there. One, actually, the manufactured stakeholder group wasn't that interested in that piece. That wasn't an important part for them. And secondly, it is our understanding through through financial feasibility analysis and information, even from the province's guide, that the right of first refusal only actually works in a larger urban center, not in a bigger market, in a larger housing development. So when you're having a scale of 50 units or 75 units, it's hard to make that work to have, I guess, non-market units, basically is what it would be, non-market units available to those residents. So it's just not something that works in the Nanaimo market at this time. So we didn't want to put in that because it's not super realistic for the foreseeable future in Nanaimo.
Okay, thank you. Councillor Hammonds.
Thank you, Chair. Speaking in support of the staff recommendation and the resolution on the floor, I want to say this is a housing form that I really appreciate, and I lament the fact that it's leaving. I know so many seniors who would benefit from the type of community that mobile home parks create. So I'm sad about that, but I realize the economy is what the economy is. I also note from the conversation that redevelopment of these parks in Nanaimo, based on today's market, is unlikely. So I don't feel a tremendous pressure. I also understand that staff's recommendations provide greater protections than what is required in legislation. So I feel like we're going a little bit beyond what we need to do. So we're kind of meeting that middle ground, recognizing it's imperfect, recognizing that if mobile home parks do get redeveloped, that lives will be impacted, and that's real. And I want to thank Mr. Snyder for bringing that language to it. But ultimately, I don't see the pressure based on the economy, and I see City of Nanaimo working to provide or protect residents to a greater degree than what is currently required in legislation. So it has my support. Thank you.
Councillor Perino.
Thank you, Chair. Just also, I'll be voting in support of this. I want to say, Mr. Schneider, you've done an excellent job to support your communities, all of the communities that are in mobile home parks. I think you've done a very good job today. Yes, what you're asking for is, I think, probably too much. And the reason why I think it's too much is because if we force the landowner to get to the point where it becomes so onerous and so expensive, they may consider eviction, and that's a worst case scenario. Whereas what our staff has done is bring forward policies that they hope we'll pass today so that developers, the landowners, will in fact say, okay, I can manage this, this works. And it gives enough to the homeowner of the mobile home to be able to make a move. Will it be easy? Will it give them all the answers that they need? No, it certainly won't. However, When we move into our homes, if we're moving into a mobile home park, we own the home. We do not own the land. And that is our right to do what we want with our home, but certainly not with the land. That's up to the landowner. So we need to protect those homeowners for as long as possible, and I think that this policy does do that. I certainly don't feel that there's an immediate risk. I think that we are safe for a number of years because of the way the economics are. But as you said, let's do this for the future. And we'll have to review this at least every 4 years. I wish we could do more, but I don't want to discourage the landowner from doing something that would be even worse, such as eviction. So I'll be voting in favor. Thank you.
Thank you, Councillor Gesselbrock.
Thank you. You know, although I strongly believe that improving the protections for manufactured homeowners is very important, I can't support the current policy because I think that we can do much better. I think that with, you know, some additional amendments, we could make protecting this form of affordable housing much stronger and not be susceptible to land speculation, which basically is what is changing this area. And I think there's, you know, it's a large vulnerable population, and this is a form of housing that we probably will never see again. And basically, if we don't have the proper protections in place, basically we are turning it over to be developed into more unaffordable housing, which we have an abundance of and not enough affordable housing. Thank you.
Thank you. Yeah, this is a tough one for me because I do hear what what Mr. Snyder has presented and the manufactured home community stakeholders group, and I understand the emotion behind that about you know, losing your home, losing your community. This is about people. I am concerned that if we go too far, that we will push landowners who do want to see changes to the land that they own use the eviction process, and I think that that would be tragic. There are things about these proposed policies that I do appreciate. I know that the relocation coordinator wasn't something that the stakeholder group was terribly interested in, but I do note that when you mentioned that one of your neighbors has Alzheimer's, that those are people that are going to need assistance, and they're going to need somebody to help them walk through this process. And I think it's really important for the city to be able to provide those kind of services and to help people in this situation. So I will be supporting this. I will be watching closely, and I think that any landowner that thinks that they're going to redevelop a mobile home park should look carefully at what happened in Surrey, because I think the community spoke loudly there and helped to turn the dial for the people that owned the manufactured homes. This is a step in the right direction, but yes, I think we're not going to see more manufactured home parks built in Nanaimo or in any other urban area just because of the changes that we're seeing. We're not getting any more land, and land is getting more precious. So with that, I will ask for a vote, and all those in favor. I see Mayor Krog, Councillor Perino, Councillor Manley, Councillor Hemmons, Councillor Eastmere, and those opposed, Councillor Gesselbrock, and motion passes. Next we have question period. There are no questions, so next I'll ask for a motion to adjourn. Mayor Krog, Councillor Perino seconds.